program under the Federation of Malaysian Business Associations. This is our second program. We started this first round exactly on the 1st of July with the KPD and HEP minister. And after 22 days, we are back with the man of the hour of probably the last 18 months, Tan Sri DG, Tan Sri Noor Hisham Abdullah has been actually in the forefront of fighting the COVID war from the very beginning to now. So it's really thanks to Tan Sri, he's decided to spend a couple of hours with us to share the Ministry of Health's opinion and his opinion about how the pandemic has fared on from day one right down to 18 months and as we exit into the National Recovery Plan. So Tan Sri, to get the ball rolling, can I ask the Pro Tem President of the Federation of Malaysian Business Associations, Dato Abdullah, to have his opening address. Dato.
Okay. Thank you so much, Dato Kumar Raja. Very good afternoon. Assalamualaikum warahmatullahi wabarakatuh. And also wishing all our Muslim friends Eid Mubarak. Maaf Zahir dan Batin. Firstly, Tan Sri, it's a very big pleasure for us to have you on board. Alhamdulillah, we have more than 100 people from different various associations today. And this is a great opportunity. And this also shows that the government is engaging with the rakyat, with the industry captains to ask for feedback and to work with us. So we do very much appreciate your time. And our topic here is engage, explore, and empower, working with the government. So today will be a day where we can have an open and a frank talk. And we have an agenda lined up for the next 2 hours. So just to let you know, this FMBA was formed last year. And the main intention or our main vision is to help businesses to come out of this pandemic as soon as possible and to work in line with the government and give ideas and suggestions and feedback from the man on the street. Because we are down here and we know exactly what's happening at our level. So once again, Tan Sri, thank you very much. Back to you, Dato Kumar. Thank you.
Thanks, Dato Malik. I think you have really brought back the time. You were just 1 minute late, but we have brought back the time right to spot on. Tan Sri, before you just go on to presentation, I think your back office has already had the slides ready. Just to introduce Tan Sri, basically what you have is probably 100 over captains, exactly 101. Across many industries, Tan Sri has done this. I know that with FMM, Tan Sri has done this with the Dewan Perniagaan Melayu Malaysia, the DPMM group, and also the National Chamber and the Chinese Chamber. This is again a very diverse group of businesses, primarily in the services sector, representing close to about nearly 7 million in terms of workforce and across about 64 different industries, Tan Sri. So I'll leave it to you to start with the presentation, Tan Sri. Then after you're done, then maybe we'll start on the Q&A.
Thank you very much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. First and foremost, I'd like to thank the Federation of Malaysian Business Association and the members for having me here today. And more important is that this is a platform that we can engage and probably explain issues and challenges and see how best we can solve this problem together, this pandemic. Basically, we are looking into both in terms of life and livelihood. And before WHO announces any pandemic, they have to consider 3 factors. First is the virulence of the virus. So if there's a virus, then they have to look into that, the virulence. Second is that in terms of transmissibility, how the virus is going to spread and how fast it's going to spread and etc. These are 2 important factors before they can declare a state of emergency. And third is economic sector. They also have to look into economic impact before they can declare. Now, we do know that from our last 18 months, this virus accelerates very fast, and more so the new variant, etc. But it decelerates very slowly. And if we were to open up prematurely, this is the problem that we face again and again, not only our country, but many countries have done that. We have the advantage of 2 or 3 months ahead behind certain countries, like, for example, UK, US. They started the vaccination early. Now we are learning from them not to make the same mistake they have done and probably see the impact of what they have done right and then can follow. Next. So to start off, we just look into the whole scenario of third wave. We managed to control the first wave very well, short period of time. We have the first case on the 25th of January and until 14th of February. 22 patients, no death at that point of time. Most of the patients at that point of last year was from Wuhan. We are bringing the virus from Wuhan, and 6 local got infected, and also they have direct contact with the tourists from Wuhan. Then we have 11 days, period. They stay calm before the storm. No cases been reported, and on December end of February, we had a lot of Malaysian returnees coming back from other countries like Japan, etc., bringing the infection. And on the 9th of March, I was informed by my colleague from Brunei that one participant in Sri Petaling Mosque, Jemaah Tabligh, came back and tested positive. So we were shocked. So we went down to the ground, and at that point of time, we were informed that there were 15,000 people, gathered at the mosque from the 27th February until 1st and 2nd of March. By the 10th of March, most of them had returned back to their kampung, and also 1,500 from overseas, from Indonesia, from India. So we know that within 2 weeks or 3 weeks, we will have a spike of cases from Perlis until Tawau. That's number one. Second, also we thought that, okay, and then we have a group that have gone back to their respective country, like India. So we know that just a matter of time, India will be the epicenter because of the density of the population and etc. So what we did is, then we have a new government came in, we advised the government what to do and what not to do. We learned from the delegation from China in terms of how to implement. So at that point of time, we advised the government to have a lockdown. And we intended for a short, sharp, and hard lockdown, and which we did on the 18th of March 2020. And within less than 1 month, 14th of April, we managed to basically curb the infection and flatten the curve. And this was within 4 weeks, and we have seen the impact. But at that point of time, because a lot of us complied to the SOP and was total lockdown, you can see we managed to control the infection down to less than 5,000. Although JP Morgan at that point in time predicted that we will have 6,300 cases. And on later, because there's a Ramadan coming in and a Hari Raya, so we extended about 2 weeks. Post Hari Raya, there was no spike of cases and everything was well controlled. So we move on to a conditional MCO to allow the business to function back. Later 1 month later, we move on to the recovery MCO, and we managed to bring down the cases. 0 cases on the 1st of July. And the cases were single digit. We managed to control it, although there were spike pockets of infection here and there. We managed to contain the infection very well. Until and there was a lot of pressure to open the international border. We said that, okay, international border, probably we have to slow down a little bit, because most of the infection then comes from overseas returnees, for example. Then when PRN Sabah came about, and obviously we have the 2 PRK before, Slim and also Chini, and we had our SOP. There was no outbreak, there was no cluster after the PRK. So when PRN Sabah came about, again, if possible, we do not want to have the PRN, but we do not have the power to stop a PRN because under the constitution. So we have the SOP in place, but unfortunately, because it's a tight, in terms of election, there's a lot of non-compliance in terms of political rallies, etc., on both sides. So we can see that after, in fact, we wanted to put in the safeguard before the PRN. We also been threatened by political parties, take us to court because this is the constitution, they have the right to vote, and etc. So we say that's okay, then you have to comply to the SOP. But obviously, compliance was a big issue. After the PRN on 26, 27, we started, lockdown in the sense that those returning from Sabah, we make sure that they have the swab negative, we quarantine them for 14 days. And that's how the spread came about. And on the first 14th of October, if you look back into our publication or even messages in the media, we wanted a total lockdown on the 14th of October, but short only for Selangor, because the spike is mainly in Selangor. At that point of time, if I'm not mistaken, in Mukim Klang, not Daerah Klang, but Mukim Klang. Daerah Klang are two Mukim. There is actually Kapar and Klang. But again, because of the economic impact, so we went for CMCO because we try to balance health and economy. So we allow economic sector to function, but other sectors, social sectors, education sectors, and all that put on hold. So we managed to bring the impact was we managed to bring down the infection rate. The R0 when we started the PRN Sabah was 2.2. It came down to about 1.1. So 1.1, 1.2. That's about all. We couldn't bring it down further because economic sector is still functioning, which means there are people moving, movement of people, and also gathering in the workplace and etc. So infection continues to spread to the community and etc. But at a very slow pace. If you look into this graph, PKPB Lembah Klang 14th of October to 14th of January. See, the rise is actually gradual because it's 1.1 or 1.2, which means every cycle 10% or 20% increase. Therefore, you can see gradual, not the spike, exponential spike. We were worried about the exponential spike. Then on December 7, the government decided to give the onus to the public to take care of themselves, comply to the SOP, and allow interstate and inter-district travel. So that was the decision we made because we want to help the domestic tourism and etc. And sure enough, during the Christmas and New Year, hotels in Langkawi, Malacca, all fully booked. But we anticipated cases will go up. So right after Christmas, you can see the R0 went up as well as the cases are going up. So we have to advise the government to implement the PKP 2.0. But this PKP 2.0 again allowed the economic sector to function, but tighten the social, education, sports, and etc. Then we have a spike of cases on the 29th and 30th of January, of which 5,725 cases. And we have seen after the impact, it came down because we control the social sectors and etc. It came down nicely until 5th of March. That is actually we move on to PKPB and PKPP certain states. But when we start to open up education sectors, because we are still 4 digits, probably from 5,000 we brought it down to 1,000 plus, and there's one day I think we have 960 cases. But when you open up social sectors, education sectors, and etc., and comes Ramadan, you can see the cases went up again. And there was an infection in school, in universities, and etc. So cases went up, and we said during the Ramadan, there's a lot of gathering, there's a lot of mental fatigue, physical fatigue, and people want to celebrate a double raya celebration, etc. And we open up a lot of sectors, business sectors, but the caveat is that comply to the SOP. But compliance was the issue now, and enforcement was the issue. Like Bazaar Ramadan, etc. You go down, there's no compliance, but we did not take right action to close down and etc. So, and on the 12th of May, we started the PKP 3.0, and again, economic sector allowed to function, but the cases continue to spike until 9,020 on the 9,020 cases on the 29th of May. So with that, you can see the spike was actually very steep. And we were worried that it will continue vertically. So we implemented 1st of June, very tight, only essential sectors. And the good thing is that within 10 days, we can see the curve reflected and it came down, which is good until 24th of June. Now, 24th of June, and it continued to accelerate exponentially going up now. This is what we are facing now, going up. So why? Because the MCO was in place, and compliance, maybe compliance issue, but still, I mean, interstate travel, everything will put on place now. But we believe that 24th of June, there's already a new variant spreading very fast. Now today, we got the news that all states already, we have the Delta variant, except for Kelantan and Perak. Have not been documented yet, but I'm sure the virus already have actually mutated and spread like wildfire. So this is why we are seeing acceleration phase now until today. Yesterday until 13, yesterday about 11,000 plus. So we hope that the initiative, the activity that the public health measures that we are doing and second wave works well, but now it seems that it doesn't work that well before as compared to last year. So now we have the option, trying our best to bring it down, but we cannot depend on public health measures anymore. One, because of the prolonged fatigue and mentally and physically for the public as well as the healthcare, economic sectors suffers. Again, that's because we believe that if you do a prolonged partial lockdown on the 14th of October, that's the implication that we are seeing. It's better to do a hard, fast, and a sharp lockdown, and then probably a short period of time, then recover fast, just like what we did in the MCO 1.0. So these are the two lessons that we learned during the 18 months. A hard, sharp lockdown is much better than the prolonged partial lockdown dragging for 10 months, for example. Next. So again, you look into the chart, the blue chart is actually our expected, when we did the total lockdown 1st of June, we expect it to come down as in the blue line, but on the 24th of June, then it went up. This is where we are trying to see what went wrong. Basically, I don't think what went wrong, but what happened during that period of time. This is because of disruption of our planning because of the new variant. And we have documented the new variant, Delta variant, spreading like wildfire. And you can see that the acceleration phase followed the red line back again. So it went back to 1.2, probably non-compliance, probably because of new variant. It went up now. So now it did not went up vertically, but now you can see that there are some point of time, last couple of days for 1 week, you can see that it's moving towards the peak. We hope that we have reached the peak and then we expect to come down. So this is a challenging thing. Whatever we plan, if there's a new variant coming in, you disrupt. And the disruption now variant, this variant is a very high transmissibility, and this is what we are seeing today. Next. And this is our projection looking into the vaccine. So now we use public health measures and we have to rely on vaccine now. And we have shown vaccine works. Now, if we were to give a vaccine, second dose vaccine, 150 per day, this is the forecast that is in the blue zone. That means you can see the trajectory goes up and will come down. And taking into account that the average efficacy of the vaccine is 75%. So we have a portfolio of vaccine. Pfizer, for example, 95%, AstraZeneca, 91%, then we have Sinovac, 65%. So mean of 75%, this is the expectation that we think that we can bring down to 1,000 cases, maybe end of October or even early November. It depends. If we can increase more than 150,000 vaccine for second dose vaccine per day, then I think the impact will be better. So we hope that this is only our solution now. We have to rely on the public health measures and the vaccination. Next. Now, if you were to look yesterday, we have 11,985 cases. Imported cases only 7, which means our border control is good now. As compared to the second wave, our border control is not as good, and the cases are mainly imported cases as compared to local transmission. And obviously, active cases now 137,587. We cannot put all these positive patient in a hospital or PKRC. So we have to resort back to category 1 and 2. There's asymptomatic or mild symptoms to stay at home. This is exactly what UK did earlier. So that category 1, 2, and 3, they use quarantine at home. Now, ICU beds, 927 admitted to ICU and 459 needed ventilation. And our death rate yesterday was high. Fatality is 199. Total, our rate is 0.78. If you compare to Africa, it's about 4 to 5% of that. And you look into UK, I mean, they have doubled their population compared to Malaysia. Their death rate is already reaching 130,000 people died. And ours is 7,440. Next. So this is the category. So we try to define, this is a category at the point of diagnosis. which means category 1 majority, you can see 48.8% majority, category 2 mild symptom 48.7%. Category lung infection, but they do not need oxygen. Category 4 lung infection, they need oxygen, and category 5 basically they need ventilation. So although our category 1 and 2 high, but they can progress, for example 1 to 2, 2 to 3, 3 to 4, and etc. So this is just at the point of care, and certainly we have seen in our ICU, because category 4 stay longer, about 2 weeks, and category 5 stay about 3 weeks. And so although it's 0.5% or 0.3% category 4, they continue to accumulate. So the accumulation, normally we see about 5% cases being treated at category 4 and 5 in a hospital, taking into the patient in a hospital, but now has increased to about 15%. Next. So the reason we break out the category is that some say that it's actually giving a false impression that category 1 and 2 mild cases are high, but it is also to allay fear, because if we just publish the numbers, then it can be all category 5, because the fear is that everyone is actually having category 5 need ICU beds. So this is just at the point of testing that we share in terms of the symptoms category 1 to 5. Now we look into the ICU beds. Overall for the whole country, utilization is 98% and higher in Selangor and Kuala Lumpur. Next. And obviously the death, you look into last, our mortality is 0.78%, 7,440 people. Majority of them at category 4 and 5, 85%. And 86% have some form of comorbidities, diabetes, hypertension, and etc. And 13% died at home and then brought to the hospital. Why? Because whether there's a delay in terms of coming to the hospital, or even informing us, or because of the respiratory, suddenly there's actually a phlegm or even inflammation of the lung, then the oxygenation to the brain all compromised, couldn't breathe well, and then they collapse. And male about 59%, and majority of our death is 84% is actually more than 50 years old, and Malaysian 93%. Next. So if you look into the trend of the cluster, so you can see that during the PKP, the dark blue bar column is basically workplace infection. Red is community infection. That means there's still people gathered for birthday, for funeral, and etc. The green is actually in our prison, and there was actually a congestion in prison, and we know that during the second wave, the infection is mainly in the workplace and in prison. Prison, we have solved the problem because we took over 13 PLKN and 6 Wawasan camp, whereby new prisoners will be in the transit in the PLKN for 2 weeks, and then we do a swab negative, then only they can actually join the prison and the old inmates. So by doing so, we managed to actually bring down the cases, but there's a spike of cases because they transfer the prisoners from one prison to another, and that's where I think the spread of infection. And the gray is basically from the religious activities from church, temple, and mosque. So there's gathering there in the mosque. I can see it's high, and the blue, light blue, is basically the school. So you can see that when we open up the school on April, there was a spike school and education sectors, the university, etc. Now the education sector is closed, so the infection rate in the education sector is less. So this is a monitoring process that we have put in place. Next. This is a testing. There's a lot of issue with regards to testing. Now we test about on the 21st of July about 130,000. So normally, if you have one positive, the adequate testing. What is adequate testing? One positive, you expect minimum of 10 negative, or the best will be 30 negative. So if minimum of 10 negative, that means 10%, not more than 10%. If you detect more than 10%, that means there are more virus there are more people out there and positive that you are not detecting. So at least less than 10%. So if you can do about 3.3%, that means 3.3%, that means 30 negative, then that means it's adequate testing. So our testing in March is about a 2 point something positive, which means because at that point of time we'll be complemented by SOCSO. SOCSO are doing the testing for the foreign workers and etc. So we have a high testing, daily testing for the public, and it must be a targeted testing. So example in the outbreak in Sabah after the election in Semprona, every 100 people that we test, 80 of them positive. So 80%. So 80% at that point of time, we have to make a declaration that everyone in Semprona is positive until proven otherwise. So we make sure that our testing capacity was actually lacking in Sabah. So what we did is that we sent some of the specimen to Semenanjung. But by the time they get the result, almost already 10 days, 7 days and 10 days. So we make a policy that everyone stays at home, and like a curfew, stay at home. So if you are positive, you are not infecting the public, the community. If you are negative, you are not in the community, you're not getting infection. So that by doing so, we managed to break the chain of the infection, and we continue to focus targeted screening at the kampong, a high risk area. Next. So today, last couple of weeks, we already announced self-testing. That means you can buy this G-Mate or Silicium made in Malaysia, G-Mate from Korea, and use your saliva to do a testing. So that will RTK antigen self-test using your saliva is actually good. That you can buy it from the pharmacies and etc. And then you can keep it at home. You can test it yourself. If it's positive, then you bring the kit and report to the PKD or CAC, and then we'll advise what to do. Basically now, category 1 and 2, we advise you to stay at home and monitor closely using MySejahtera and etc. So today, only 2 companies have been approved. Their sensitivity is much better because more than 90%. So using saliva testing. We have another 15 companies in the process of evaluation of their test kit. Hopefully it will be approved, then we will add on. And another 40 companies now have applied. So we hope that we can have competitive market pricing in the private sector, in the pharmacies and all that, to bring down the cost. I was informed the cost is about less than 40 ringgit for one test kit. Next. Then this is our challenge now, the variant. There's no more Wuhan virus. So Wuhan came in, and then it was replaced by mutation of D614. Everybody knows about the cluster Siva Ganga in Kedah, spread like wildfire. Within 3 weeks, the whole Kedah was infected with the D614 and also the Makcik Ipoh. So because of that, then we went on to quarantine in a hotel rather at home. And now this variant is replacing the D614, and we have documented alpha variant from UK, beta variant from South Africa, gamma variant not documented this country yet. Delta variant that is actually from India. So we have, and also variant of interest but more our focus is mainly on variant of concern. Next. Now you look into the variant of Delta now. The whole world, the dominant virus is Delta variant. Now in the Wuhan virus, the spread is the R0 is 2.4, which means if 100 people get infection, one cycle 7 to 14 days, they'll infect 240 people. But now, 100 people get infected with Delta variant, they can infect 800 people, 500 to 800 people within a short one cycle. So this is why the transmissibility is very high, very fast spreading the virus. And obviously, if you look into the Delta variant, the infection is mainly in the lower respiratory tract. So the virus goes in straight away in the lower respiratory tract, and less in the upper respiratory tract. So that's why you do not have symptoms like anosmia, loss of smell, loss of taste, sore throat, or even some of the symptoms that they have is actually respiratory symptoms, but most symptoms a bit too late. And also there are some of the symptoms that they have, those patient experience is diarrhea, vomiting, muscle ache, and malaria, and etc. Next. See, you look into the alpha variant, beta variant, and delta variant. Now, lately we have seen in our testing that delta variant is increasing, 83. Before that was beta variant. Every state have beta variant, 196. But now Delta variant is replacing the Beta variant. And recently, I think in Sarawak, not reported here, I mean, they have 70 cases, 71 cases reported in Sarawak, Delta variant only. So, well, Delta variant will replace the Beta variant, and this is why there's a number start to increase exponentially in the acceleration phase. Next. Okay, this is the vaccine. So we are hoping that today the total cumulative vaccine dose administered is 15.5 million, and first dose already yesterday was 446. Of its first dose 282,000, and second dose 163. So that's above our target of 150. So we can increase the second dose. That means you have good protection. Now the vaccination. The best protection is that 2 weeks after the second dose. First dose is as if that you do not have the vaccine. So they give you a minimum protection, only about 33%. Second dose, you must have at least more than 2 weeks to optimize the antibody response. This is for the vaccine, 2 doses of vaccine. But we have CanSino and also Janssen vaccine, a single dose. For the vaccine to be optimum, you need 28 days before you can actually have a full protection. Next. So again, this is our target. We have seen operational surge capacity because the infection, 70% of infection now in Klang Valley. And because of that, although the public health measures has been on for many months, but again, the impact because of the new surge of vaccine and virus. So we are using the vaccine that we have, Pfizer, AstraZeneca, Sinovac, to increase our vaccination in Klang Valley. So we hope that by 1st of August, all adults in Klang Valley will be vaccinated at least 1 dose. So by 21st of August, mainly 3 weeks later, we hope that they achieve 2 doses, and that will give us the protection, and perhaps early September, then we can bring down the cases and flatten the curve. Next. Now, this is based on the incidence rate of the infection. Now you can see that majority of those infected is from age 20 to 59, peak at 20 to 29 and 30 to 39. Next. And this is phase 1. Phase 1, we vaccinate only the healthcare workers. Phase 2, mainly here you can see the phase 2 on the week number 16 for elderly, for those who have comorbidities. Now, the impact of phase 2 after 2 weeks, I mean 17 and 18. So we started 16, 17, 18, and 19. You can see the green line, that is those age 60 and above is actually decreasing. So it shows that the impact of the vaccination works in phase 2 for the elderly. Now increasing is the red line, that is actually the young population, that is 20 to 39 years of age. And obviously those 40 and 59 are still increased, but stabilizing now. We hope that if we can cover the 40 to 59, then it will also decrease like we see in the age 60 to 79. So this is very promising, showing that vaccination works in phase 2. Phase 2 mainly for those elderly and comorbids. Next. Now, this is among the healthcare workers, phase 1. We vaccinate phase 1. We started on 24th of February, and then March, we started full force vaccinating frontliners. And our frontliners in Ministry of Health, we have this regular periodic screening. So you can see that out of 245,995 frontliners or healthcare workers in the Ministry of Health, those who have completed the vaccination, they all have completed the vaccination, fully vaccinated, more than 2 weeks, and those got infected is 3,778. And of which you see category 1, 1,215, no symptom at all, but they are positive because of the periodic screening, because they work in the ICU, COVID ICU, COVID ward, and etc. Category 2, mild symptoms, we have 2,555. So 67.6%. Majority of them category 1 and 2. Category 3 with lung infection but do not need oxygen, we got 5 cases. Category 4 need oxygen, 3 cases. which means now if you are vaccinated, you still can get infection. You can be infected, but your symptom-wise actually in category 1 and 2. None of our patients are in our healthcare workers in category 5, which means we can reduce hospital admission and ICU beds. So the solution is to vaccinate. This is from our experience of category phase 1 of the vaccination. So we have phase 1, we have phase 2. Now we are in phase 3, and phase 4 basically focusing on the economic sectors and certain groups. Next. Now look at the Labuan. Labuan have 7,473 cases for 100,000 population, highest in Malaysia, followed by Negeri Sembilan, Kuala Lumpur, and Selangor. This is basically looking at the population. Our mean is 2,450 cases for every 100,000 population. So Labuan is the highest. Let's learn from Labuan what we did in Labuan. I was very worried for Labuan initially, last 1 month ago. Next. See, this is because Labuan, we know number one is that they are infected with the Delta variant. On the 21st of April, 7 Indian citizens, crewmen from shipping industry, flew from India and arrived in KLIA. They are supposed to be quarantined in KLIA, but they took the domestic flight directly to Labuan, and they transit in KLIA for 24 hours. So on the 23rd of April, they flew to Labuan, and this is a flight, a plane. So you can see the green zone is actually warga negara, that means our citizen. The blue is actually the citizen, and the yellow, so their seats and etc. So they infected 6 people, local, in the same plane. So 6 people, and then we went back to Labuan. They were not quarantined because they are local. But those flying from India, they were quarantined, but they already infected the local. Next. So that's how the infection start to spread in Labuan. And you can see the first infection arrived on 23rd of April. And then during the Ramadan and Hari Raya, the cases continued to increase to 1,344 cases in 1 week in Labuan. Labuan is a small island, and our hospital capacity is very limited, only 100 plus beds only. And we cannot handle the increase of 1,000 cases in 1 week. So it was a very difficult situation then. So we have to open up the badminton hall to accumulate. To have 650 beds there, and also we started the field hospital by the the Angkatan Tentera Malaysia, and to accommodate, and we have 22 extra ICU beds created to cater for this group. Next. Then what we did is the only solution we had at that point of time is that public health measures not good enough, but we add on with vaccination. So on the 21st of July, if you look into the dosage, that adult dosage coverage is already about 70.6%. Adult already received 2 doses of vaccination. And that's actually every day, I think they are increasing about 3.7%. So within a period of 3 weeks, they managed to vaccinate 70% of the population 2 doses. Now you look into the graph, 63.6% already have initially the first dose and the population. Now 92.4% single dose, 70% have 2 doses of vaccination. And because of that, you can see the outcome of Labuan. Next. Now you see that the cases, the line, the blue line, the linear line going down. When the vaccination, the yellow line is actually dose number 1. Dose number 2 is actually the gray, and the gray line goes up, then the cases goes down. So if this happens, our experience in Labuan can be replicated in any other states like in Selangor, etc. You have increased vaccination, and then there will be decrease in the cases. And this is what Labuan has showed us, that this is the way to control the infection. Everyone must be vaccinated as soon as possible. Next. So again, this is plan pemulihan. We have fasa 1, fasa 2, fasa 3, and fasa 4. Fasa 1 to fasa 2, 10% of population must be vaccinated. Fasa 2 ke 3, 40%, and Fasa 3, 60%. So this is a rough guide to look into our vaccination rate and also our response. The most important is the ICU beds. If not enough ICU beds, then we are not able to accommodate a patient in category 4 and 5. Then plus our daily cases. If we can control the daily cases, that means we can control the progression of the disease. Next. So that's about all. Very short. I'll give you a bird's eye view of where we were, where we are, and where we are heading in next couple of weeks. So we hope that by increasing the vaccination and using the public health measures, we can actually control the infection and open up the economic sector slowly but surely, and hopefully that we can control this infection in the country. Thank you very much.
Thank you, Tan Sri. I think that was very splendid, and I think you kept exactly to time, Tan Sri. You have, I mean, from my little experience, seeing you 10 years ago, you have not lost any of the sharpness you had as a practicing surgeon when you were doing this in Ward 12, Ward 13 of HKL. That's when I was a medical officer on the other side. So I used to know you since then. I think you're still a clinician first, then a bureaucrat next. While I think it is also good that Malaysia has you as the DG of Health now while we go through the pandemic. Tan Sri, we have about 136, nearing 140 industry captains on Zoom with us today. So just to set the tone, can I call one of our stalwarts? I would probably reckon that he's one of our FMBA advisors, but he's also the only Malaysian who owns a hypermarket in our country, Dato Amir Maidin, to actually set the tone on what the next 100 odd questions would probably be. Dato?
Thank you. Tan Sri, Assalamualaikum, and of course it's an honor. Thank you for coming. We all appreciate the time that you're taking to explain. Although whatever you have told us is very depressing, very, very depressing. It's like going to see a doctor and he's telling us that we got everything that we should be worried about. There's a way out. As doctors always say, surgery is always good. Let's avoid surgery. But I think the main issue and the main challenge here is, we all understand that vaccination is that silver bullet. We understand that. And we are not here on the blame game to say, why are we late? There was no vaccine and all that. That's bridge under the water because it's gone. Now we assured vaccines are here, and vaccine is also for sale. We were told, I read this morning or yesterday, the vaccine is for sale, which is good news actually, so that whoever wants it, go and get it. And don't blame the government for it. Go and get it. If you want it fast, go and get it. Fine. But we are suffering, Tan Sri. We are suffering. We are really suffering. And I think you could have seen the video. I said people are no longer stealing television set, but they're stealing ikan kembung, all right, and sayur. So it's really bad out there, and we need a better alternative. We don't have the answer. We're just laymen here. All we know is buy 1 ringgit and sell 1 ringgit 10 cents and make the 10 cents. Hopefully we make more than 10 cents. But the main issue here is that how are we, and I'm very sure, Tan Sri, nobody in this group is going to wait looking at the chart and listening very attentively, seriously. We're saying probably November when the thing goes down. Plus or minus. Silap, minta maaf, I'm not the technical person here, but like that, it's going down. And for Selangor, maybe it's early September. I don't think we can wait. What can we do? What can we do? There must be alternatives with your wide experience, and there's happening in UK, they're opening up, Singapore is open up, whatever. And after this, of course, Tan Sri Teo, our president of the Mall Association, will give you more details of how we are suffering. But we need to do something almost immediately in terms of opening up. We have to do it. I don't think we have a choice. I know there will be collateral damage. We always think about it that way. But nobody wants his mother or his brother or sister to die, obviously. But there will be a collateral damage in any war. How can we overcome this? Because I don't think we can wait that long. I will sum up later, Tan Sri, but I will let maybe Tan Sri Teo maybe give you an overall picture. How bad is it in the retail industry? Thank you, Tan Sri.
Thanks, Dato Wira. Actually, Tan Sri DJ, I'm actually going to call upon Tan Sri CK Teo, who's anyway the president of the Persatuan Pengurusan Complex, and also another iconic Wan Utama development. So, Tan Sri, to you, the slide decks are ready. Tan Sri will share it from our side. Yes.
Thank you very much, Tan Sri, Noor, Hisham. Thank you very much for giving me this opportunity to listen to our grievances. My views will be from a desperate layman, businessman point of view, not from a medical perspective. So first and foremost, we understand that 69% of cases are sporadic. Only 9.7% from the workplaces, although your chart showed differently just now, and 0.8% from shopping malls, including outside shops and shopping areas as well. So one thing we are agreed is that the government messaging tend to blame the manufacturing sector for the increase in the cases. So we wonder whether the government messaging could change so that the perspective of the many industry can be proper. So now we are saying 69%, is that endemic? We believe it is very endemic versus trying to say 70% to reach herd immunity. So we would like to think that we may have reached endemic first before herd immunity. So maybe we should re-strategize for living with this endemic. So we are very happy the last few weeks, the ramp up of vaccination, and you confirm it that the herd immunity is the key. So we are going in that direction. The research show that we can be done if there are really good efforts. So our capability, our capacity is there, which we are very, very comforted with. One of our call is that we are told that 18 million doses are coming in July. Our call is that please organize it so that the 18 million doses can be also used up in the month of July, and subsequently every month, whatever we receive, we should gear to use it up every month instead of carrying forward. And that one we hope will be able to help us get to the herd immunity faster than what is planned under our NRP. The other one is that there's a lot of apprehension is that it was announced that on 1st of August, anybody who is undocumented and who is not registered yet, or because you got a red IC or whatever, can go walk into any PBB. There are millions of undocumented people around. We wonder how we're going to control it. 100 million, a million people walk into all your PBBs and create another cluster. That is something which is worrying a lot of us when we think about it. So we are thinking about how to re-strategize for living with this endemic. First, we call that if it's an endemic situation, let us all businesses be open with SOP. Secondly, we have been calling that we have to disband with labeling essential versus non-essential. Basically, our understanding is any product or service that is in demand means essential to somebody. So the entire ecosystem of manufacturing, delivering, supply chain is all essential to us. So if we do not label essential versus non-essential, that's one way to go. The other one we want to propose is to disband the positive list, because a positive list can never be complete, never be comprehensive enough. There'll be one, certain sectors will have to waste time, and in the meantime, get more damage, appealing for it to be included in the positive list. Some of the examples is that a department store now can open, but the shop selling exactly the same thing that the department store is selling cannot open. So we do not know the rationale of it. No, shops that sells apparels, shoes, sports, jewelry, home appliances, living things cannot open, but all these are available in the supermarket or in the department store. So there must be some deeper rationale on that. We advocate that we adopt a negative list, and only those businesses that definitely cannot meet the fundamental SOPs should be in only those are in the negative list. What are the fundamental SOP from our point of view? Able to not able to social distance in the operation, cannot wear mask, or cannot take temperature. Those are the fundamental. If you can meet these three, we should not be in the negative list. What is very important is time is of the essence, and we are already very weak from our exhaustion of our savings or whatever energy we have. We are in a very weak position already. So if we delay further, more businesses will close, which will cause more unemployment. And the longer we wait, we are getting weaker. The chances of recovery gets much tougher and more risky. The mood of the people now is in despair. We don't see any light in the tunnel. A lot of my tenants are saying we want to even give up trying. We have all these 17 months, they have been trying to survive. But now they are saying we give up trying. We must also save whatever savings we have left to see through. And the other story that's going around that's very worrying is that some have been brought into bankruptcy. And now they learn that to lift out of the bankruptcy status takes a long time. That means preventing them to restart. So now people are now trying and give up faster before reaching the bankruptcy stage, because otherwise the hurdles will be much bigger, much more higher to restart. So the other part is that we are saying we believe one dose, the efficacy just on your chart shows 75%. We thought it was 70, so it was even better. If we have one dose, can we allow all of us with one dose the freedom to move and to work full time? And this group of people with one dose is not counted in the threshold of percentage of allowable workforce, like presently 60%. Those with two doses should be able to do everything back to normal, even go to cinema, take sports, entertainment, whatever it is. With that incentive, I think this lingering group of anti-vaccine people may be able to change their mind and also queue up to get vaccinated and help us reach the herd immunity faster. And last but not least, the FMB. We pick up FMB because it is a very substantial part of our economy, especially in the merchandising side. At the moment, they are allowed to take away, but take away at best is 10% of the normal turnover. Today, because there's no dining, some can reach up to 20% of turnover. But that is not sustainable. They need to reach 50% to become sustainable. At the moment, 10% is only mitigating further losses by getting some income to meet some bills. So one of our proposals is that those with two doses, which we can very well determine from the MySejahtera, allow them to dine in with social distancing compliance. And those with one dose, allow them to dine in limited to 2 packs per table. So this is our very brief plea for considering that to live with endemic position rather than to continue with our old method of control. Thank you very much, Tan Sri.
Thanks, Tan Sri Teo. Tan Sri DJ, do you want to like?
Yeah, I think I answer the two questions from Dato Amir Ali Maidin and also from Dato Teo. Now we are in a war. See, this is the situation we're in, and how to strike the right balance between both. And if this virus is the old circulating virus, I think we have succeeded. But now this is a new virus disrupting everything. Number one is airborne transmission. It's not droplets anymore. Distance doesn't matter. You know, we are talking about social distancing, physical distancing, 1 meter. But now they have shown that you don't need 1 meter. Our close contact definition is that you must expose to the person more than 15 minutes, then you will consider, and less than 1 meter, then you are a close contact. But now with this variant, 15 seconds, you really get infection. And you are in a distance, so you can get infection because it's airborne now. So this has changed the dynamic of how we do things now. Even you are putting on a mask, also we are query whether you get infected or not. That's why it's spread very fast. The R0 is a case 5 to 8. 100 people infected, they infect 800 people. This is documented in China. This is documented in Sydney, whereby the stewardess actually been quarantined for 14 days. After quarantine, he was very happy, went to the mall. And the person drinking a coffee just from a distance also got infected. So these dynamics have changed. That's why I think the infective rate is going very high. That's number one. Second is that we are not talking about zero anymore. We are talking about to live with the virus. To live with the virus is majority of them in category 1 and 2, we can live with the virus. But our capacity in hospital, now you can see our capacity in hospital is full. You get infected, probably you don't even have a bed. Even in private hospital now, the ICU beds already occupied more than 70%. So this is exactly what happened in India. The CEO in India, 7 of them got infected. They couldn't even get the ICU beds in the public hospital, of course. Private hospital, they can't get the ICU beds, and they succumb, 7 of them. Again, because of this variant, it's spreading very fast. So it's very challenging for us. If we can manage, our hospital cases are less, we can accommodate, probably control the category 4 and 5, then probably we can, open up. The more we open up, the more cases will be infected, and you'll end up in our hospital. So again, on both sides, I understand the economic sector, but now it's between economic sector and life. We are in a war. So how are we going to strike that balance now? Today, for example, if you are infected, doesn't matter who you are, whether you are kerabat, whether you are politician, whether you are tycoon, whether you are a millionaire, once you're infected, that is our challenge now. Poor and rich equally affected. So now we are in the war looking into it, and we need to live with the virus. But how to live with the virus now? Vaccine is a solution. If we can get the vaccine, push everyone in category 1 and 2, as you see the healthcare workers being infected, they're in category 1 and 2. So we can live with the virus now. So we must learn how to live with the virus. In the meantime, how to open. Now, we want to open, but again, once you open, that means infection will spread. As long as there's a movement, as long as the gathering, there will be a spread of infection. Economic sectors we have allowed from October. We did not close in October for economic sector. Even in January 13, we did not close the economic sector. Even in 12th of May, we did not close the economic sector. Only 1st of June, we thought that we can close, close all sectors, essential services, allow essential services only. Within 10 days, we flattened the curve, and we thought we were doing well. But when the new virus came in, disrupt the whole thing, and this is why it's very challenging. Now, sporadic and cluster. Sporadic means you don't even know where you got the infection. Cluster, at least we can link the infection to the factory or etc. So you may be walking in the street, suddenly you got infected, you don't know where it comes from, the infection. And we want to change it endemic. Endemic means we can manage the cases. In category 4 and 5. Now we cannot. All our hospital is full, and death rate will continue to escalate. That means we are seeing now increasing numbers of patients dying now. Like in India before, probably 5,000, 6,000 deaths a day. Like in UK, the same thing. But now, once you increase the vaccination, then although infection rate is very high in UK, yesterday was about 50,000, but death rate is about 46, so they can control that. Here, we don't even have space to keep the dead body now. We have to come and bring in the container. In HKL, we got 4 containers. 1 container can fit in 45 bodies. 4, and then we have no space in hospital. We have to use the TPCA, the Institute Sukan Negara space there to put the dead body there. And we hope that the turnover, we cannot keep the dead body for too long. Within 24 hours, 48 hours, they must actually process because cases are keep coming in. So we are in that situation now. And this is why we need to strike the right balance between two. I think everyone is suffering, not only economic sector, the social sectors, the health sectors, and etc. Health sectors is almost collapsing. If that's the case, then if we cannot defend this, it continue to spread, every one of us infected. Today, ask yourself, if you are infected, what's the consequences of surviving this infection? If you are vaccinated, probably category 1 and 2, you can survive. But if you are not vaccinated, category 4 and 5, there's no health system to actually to help you to come out from that area. As I said, Delta variant, the infectivity is 5 to 8 times. One person infected, they will infect 8 people within a short 1 week. And then second is airborne now. Third is a disruption into the whole planning that we have. And this is why I think we need to sit down to understand how best we can move forward. And we are looking into the phase 3, to allow the economic sector to start back again. Now, even in phase 2, if we can get the 20% of the vaccination people, we are trying to create a hub now. Say, for example, if you have a restaurant, if you have a mall, all your staff been vaccinated, and you only allow vaccinated people to come in. Not vaccinated, you cannot come in. So that is where we are looking in. Like Langkawi. So, for example, if we have a hub for Langkawi, just like Labuan, everyone in Langkawi is vaccinated. And then we open up the tourism sector in Langkawi. Those going to Langkawi locally, they must be vaccinated. Then overseas coming also, they must be vaccinated. But they have to be quarantined in Langkawi only for 14 days before they can come to Semenanjung. Otherwise, they can bring the infection to Semenanjung. Can we create that kind of hub or not? For your restaurant, for your mall, etc. All your healthcare workers been vaccinated. That means at least even though you get infection, will be a mild infection rather than a severe form. Severe form is the one that we are worried about because it's probably cost your life probably. But if it's a mild form, then the business can run. So now the only solution that we have is a vaccination. Obviously, now I think the government have procure all the vaccine, 48 million doses now open up to the private sector. So Sinovac is actually open up selling to the state, even factories or private sector to buy. If you can invest in the vaccination, probably that is the solution. And we are also looking into 2 more vaccines. There is Sinopharm. There's no procurement from the government, but already approved by NPRA. So you got Sinovac, you got Sinopharm. Then Pharma Niaga also have submitted Moderna vaccine. So you also have a choice of Moderna vaccine in private sector. So for those T20 who can afford, vaccination, pay 100 ringgit or 200 ringgit to get the vaccination full dose, why not you do it rather than waiting for the government, the queue will be too long. So the economic sector, for example, your factory and etc. So if you can vaccinate all your employees to 80% or 90% of them vaccinated, then you can open up your factory fully. So this is where we think that there's solution there. Otherwise, if your factory has been infected, your staff been infected, your factory will have to close down. And then worse is that death from your workers and etc. So I think we need to look into the only key that we have now, evidence. Before this, I think PM also have discussed with me how to open up sector. I don't have a solution. The more we open up, the more infection comes in, unless now you got a vaccine. So you step up the vaccine, as shown in Labuan. I was very worried about Labuan because it's a small island, everyone get infected, then we have no health capacity to treat the patient. But now, with the vaccination, within 3 weeks, the cases come down. So step up the vaccination. The projection I have is the projection using the public sector. But now if private sector can come in full force to vaccinate your own staff, then you can open up your economy as soon as possible. So these are few models that we have. We are trying to start with Langkawi first, vaccinate everyone in Langkawi, and then open up the tourism sector only in Langkawi, but they cannot come to the mainland. Even tourists from overseas, they go to Langkawi, quarantine in the island, not quarantine in your room, quarantine the island. The island is the quarantine, just like Phuket, they are going to do that. So now, if in your business, your mall, etc., make sure everyone in your mall vaccinated, then you are protected. Then make sure that those coming into your mall must be vaccinated as well. That is a solution. That's a bubble that we can open up the economy as soon as possible. Thank you.
Thank you, Tan Sri. I think it's a very quick recap of what they said. Tan Sri, the next person I actually want to call upon is actually the president of Dewan Peniaga Melayu Malaysia, Tuan Halim, is actually with us. Tuan Halim, a quick suggestion from you.
Assalamualaikum, Tan Sri. I have actually two questions. One is about the sporadic and clusters. 69% of sporadic the people who kena the from sporadic, but the narrative from the government is from the manufacturing industry, and it can be seen in the detail of the KKM's everyday's the statistic that came from KKM. Now, I just want to have a definitive answer from you whether this KKM's statistics actually has the manufacturing sector is the highest infected clusters, or infected persons from the clusters are from manufacturing. Okay. Number two, I know that MOF under Tengku Zafrul is trying to allow dine-in for those who are vaccinated. What is your point from this? Because as you mentioned just now, if people are vaccinated and everybody in the mall is vaccinated, then the less risk there be. So can it be done for the mall and for certain places that are really easy to control, like the mall, the large mall? Okay, that is the question that I have to have for you. Thank you.
Okay, thank you very much. So now sporadic and cluster. So 70% or 69 to 70% sporadic, which means we do not know where you get the infection. Then 30% is cluster. Now 30% the cluster, we know which area or where there's an epidemiology link in the cluster. So when the 30% cluster, majority in the workplace, and of the workplace, 64% is basically in the manufacturing, 64%, and of the from the workplace, and 30% mainly in the peruncitan, and also followed by what do you call it, tapak bena. You know, this is the workplace infection that we see. So the cluster, 64% is actually in the workplace, 36% in the community, and etc. Of the 64%, half of them is actually from the manufacturing, followed by peruncitan, the restaurant, and etc. And from the tapak bena. So this is a workplace. Workplace is just one lump sum here. But this is a work cluster yang mana kita dah kenal pasti. But sporadic also infect workplace as well, because you do not know where the infection. That means the infection is in the public, in the community. Then katalah seorang worker, like hospital. I mean, in our hospital, 55 to 60% of infection is from the community. Dia bawa ke hospital. And then among the staff infection is about 29%. So and patient to the doctors is about 10%. Tapi again, the majority of the infection is from the community. So macam workplace pun sama juga, whether it's a kilang, tapak bena, restaurant, you get your infection from the community. And you will succumb because we do not know, majority of them will go to category 3, 4, and 5. Tapi if you are vaccinated, we can assure that majority of them still in category 1 and 2. Tadi ada soalan whether we can use one vaccine here. One dose of vaccine kalau dulu okay. But now with this Delta variant, not good enough. That means we have death from vaccination one dose. 232 people already have one vaccine, succumb and died. 232. And then 16 people already have 2 doses tapi less than 2 weeks meninggal. And 9 people already have fully vaccinated pun meninggal juga. So in UK, for example, they have 31 deaths from 13th of June until 18th of June. 31. 14 of them completed vaccination more than 2 weeks. So if that ada risk kat situ, tapi the risk is low. So you can compare to kalau 7,000 kes kematian, kita hanya 9 aja yang complete vaccination meninggal. So that is actually very low, 0.0 something. But still, you know, the message is that if you are vaccinated, you are all right. But if you are not vaccinated, you are at risk. We have seen family members, you know, 3 or 4 of them in one family because Hari Raya balik kampung, in fact, the mother, the father, the brother meninggal. So we are worried about this vaccine, this virus that can cause death. And on the other hand, we try to look into the bubble, how to create the bubble. This is a very fine balance between the two. And let's learn from Israel. Israel is one of the country achieve herd immunity very early. And even now, and then after they achieve herd immunity, they ease their restriction. Tak payah pakai mask, tak payah social distancing. And now the infection is spreading again. So prevention is better than cure. So although kita ada vaccine, but we also need to have preventive measures. That means pakai mask to continue, and then make sure that we take all the precaution to avoid from being infected. So that's the challenge that we have. I have the data for you to look into. Say for example, now the cluster. So you look into 30% the cluster. We have 298 cluster from 7 July to 18th of July. Of the 298, obviously community 81, and then risk group 21, and prison 14. But the workplace is 173 cluster yang terlibat. Of the 173 cluster, majority of the involvement is actually in the manufacturing sector. So that is actually 75 in manufacturing sectors, and then 25 in peruncitan, and 16 in setapak binaan. So that is cluster 30% though. The 70% is it can be anywhere. Any one of us can carry the infection. Whether it's not that whether you are in the workplace or not, you can carry the infection to the workplace, and that's where it starts the infection. So I think that is the challenging part if you look into the sporadic ataupun cluster.
Thank you, Tan Sri. There was a quick response. Actually, the next person, Tan Sri, who's got one question is actually Dato Rajasegharan, who is the Deputy President of MIKI. Dato?
Thank you, Dato Dr. EDK and the Federation of Malaysian Business Association. Yang Mulia Tan Sri, we appreciate the government's effort in trying to curb the spread of the COVID virus. It is also a concern that this can be accelerated through the means of delivery boys by Food Panda or even Grab and even courier service. Now, we are of the opinion that many hundreds of them running all over the country and even thousands. Now, they should be first tested or given a vaccination, just like frontliners in healthcare. They should be given first because they are going all over, and these should be borne by the companies concerned. Thank you.
Yeah, I totally agree. Priority should be given to them if they are out there. So I have no issue with that. But then now, in fact, when we look into the vaccination, ideally it should be given to the red district, red state, and then to speed up the vaccination. 1, there. 2, 3.
Thank you, Tan Sri. Tan Sri, after they actually have got all the questions earlier, I think we have also sent it to your officers. But just run through quickly, Tan Sri. There are questions from. So I will ask our participants who are online with us to probably quickly run through. So just let me run through a name. I'm not sure Mr. A.K. Selvam is there. Tuan Armin Banias Pahmin from the Gerakan Ekonomi Malaysia. Tuan Armin, ada tak?
Ada.
Tuan Armin?
Yeah, hi. Thank you, Dato. Thank you, Federal of Malaysia Business Association. Tan Sri, Assalamualaikum warahmatullahi wabarakatuh. Saya nak tanya, I wanted to ask Tan Sri, now, if you can see now, in those days we have a strong drive to flatten the spread of the COVID, but now you nobody speak about flattening the curve. Is it ever possible to flatten the curve? That's my first question. Because now we're looking at the daily positive cases. It is almost out of control, and nobody speak about flattening the curve any longer. And that is important for the business community, because if we looking at the daily rate, there's no way that any business can even plan what they can do in a week or a month because of the very aggressive daily positive cases. So my question is that is that ever possible for us to reach to be able to flatten the curve? That is one. Secondly, it is also very important, Tan Sri, looking at the only cure to our crisis now is via the vaccine. Is it ever possible to make it mandatory? Everybody have to go through a mandatory vaccine. Because if we put it mandatory, at least we have a scheduled timeline that the business can plan. We can start to plan our business operation again, say in August or September. But at this point of time, there doesn't seem to be a clear indication of how business can actually plan ahead for their operation, because now everything is so subjective. And looking at Tan Sri's data earlier, doesn't look very rosy. Doesn't look like we can even survive for another 1 month, and that is a grave concern to the business community. Those are my questions. Thank you, Tan Sri.
I think your two questions. Your first question, I have to rephrase it. Maybe you're asking me whether we can get to 0 cases, not the curve. The curve will be flattened. Katalah ada 100 orang in your population, ada 100 orang, then everyone get infected. So the curve will be flattened. Semua dah infected already. No new people get infected. So when no new people get infected, the curve will be flattened. That's why you see that in any population, bila jangkitan tu dah involve everyone, then there's no new cases reported, then the curve will be flattened.
That's
so
right.
The question now is whether they can get 0 or not. We are not aiming for 0. We are aiming for that to control the virus. So our country, belum lagi semua orang got infected. In India, you can see even the curve is coming down. Why? Because majority of them got infected already. So once they got infected, there's no new cases to be infected. Then the curve will go down. So that's about the curve. That's why we do not talk about the curve. But what we are seeing now is that on the 24th of June, you can see the acceleration phase. That means kalau kita dulu on the 3rd October is gradual increase. Now it's actually a very vertical increase. That means this is the new variant coming in. And that will, our challenge is how many people will be infected. More people will be infected, the curve will go vertically up. Tapi kita nak dia flatten in terms of sampai puncak, then only they come down. And anything that go up will eventually come down. So now the question is when they will come down. That's why we need to use public health measures to contain the infection. The reason why we use the strict stay at home is because if you are positive, you stay at home, you are not going to infect any other people except your family members. So then the healthcare workers will datang straight to screen your family members saja. But if you are out in the public, you're starting infecting people in the public. So stay at home is actually the key. If you are negative, you are not in the public, then not in the community, then you do not get infected. So that's why you break the chain of infection. Virus yang lama, we know that within 2 weeks, kalau tak ada host yang baru, dia akan mati. But now the problem is, we continue to move, we continue to meet people, the virus continue to spread. Now, once the virus infect a person, dia pergi ke paru-paru. Then sel paru-paru tu, the virus will continue to replicate, membiak. More replication, that means more chances for the virus to become mutated. That's why the risk. And they will destroy your lung cell, jadi scarring dan sebagainya. So that's why we try to break the chain of infection using public health measures. That's to prevention. So that's the reason why kalau kita terpaksa, we cannot be staying at home for the 18 months, for example. You kena keluar. If you go out at your home, you have to put on the double mask, put on the shield to protect yourself, and also avoid crowded places dan sebagainya. So this is a public health measures. But the thing is that kita dah lesu dah. 18 months have to comply to all this. Healthcare workers pun dah tak tahan, putting on the PPE and all that. It's just like going out, putting on a PPE, and then you are safe. Otherwise, you can get infected. And you get infected, you bawa balik ke rumah, you infect your family members, your children, your parents and all that. That's why the death rate is high. You get infected there. So that is the first question. Second is that, can we make this vaccine mandatory? Belum kita cakap mandatory, our line listing, 15 million people are waiting at MySejahtera to be vaccinated. You know, tak payah buat mandatory, voluntary pun you tak boleh settle lagi. Macam mana you nak buat mandatory? So we hope that we can clear the vaccination for the waiting list, line listing about 15-17 million people. Once it are clear, then the clinic will be a walk-in. You walk in, we can give you the vaccine. Tapi kalau kita bagi walk-in now, what about people that are registered tapi tak dapat lagi? So we clear the waiting list first, then we open up the walk-in. The walk-in we are talking about in Klang Valley saja, for the elderly. 95% of the elderly 60 and above dah registered and got their vaccine. Ada 5% tak dapat lagi. So this 5% we say that you can walk into Klang Valley punya hospital Selangor dan Kuala Lumpur to get vaccinated straight away. So only the 5%. But not everyone could walk in because the list is 15 million people waiting. So we have to clear the list first. Kalau kita boleh clear everything, then the walk-in will be there, and also the foreigners now. We have to make a policy. Policy is very clear. Foreigners pun kena vaccinate juga because they are part of the community. Otherwise they get infection, susah. But we try to use a single dose vaccine tu. Foreigners yang ada dokumen, yang tak ada dokumen, dia lari. So kita tangkap, kita vaccinate them. Penjara for example, we vaccinate them, everyone in penjara. So the one that we can catch them, we vaccinate them. Yang mana yang undocumented pun kita kena vaccinate them. Kalau tak, they start to work in Syarul Haram and etc. and then bring the infection around. So I think this is a challenge that we need to solve. But today we still ada lagi. That's why I said, although we plan perfectly, depend on this vaccine. Kalau datang December ni another new variant, definitely it's just matter of when. New variant datang, resistant to our vaccine, and then we have to start all over again. So that is again, that's why we need to have the border control. Until today, border control very tight. Kalau sekarang ni, we heard that about Lambda variant, di Peru dan South America is spreading fast, and then detection is slow. I mean, detection is not good because they can escape detection. Plus, kalau dia punya virulence tinggi, fatality tinggi, and not responsive to our vaccine, that's it. We have to go back to the cycle again. So this is a war that we are fighting with the virus. The virus is smart. When the problem is, are we ready or not to fight? We are not united, and then we are not together to fight this war. You know, we are fighting among ourselves rather than fighting with the virus. More important is that the virus is not waiting for us. The virus is actually becoming a perfect storm, a perfect virus now. If this perfect virus comes in, whereby vaccine today is not effective, and then the spread is very fast, and the virulence is very high, fertility is very high, and then that will be another challenge for us. So I think this, so far, alhamdulillah, the vaccine is still, Delta variant is still responsive to our vaccine.
Thank you, Tan Sri. Thanks, Tuan Armin. There's one gentleman, Tuan Azman Fahmi Osman. I think he's asked a question on sports, Tan Sri. Yes, Azman, quickly.
Hi, Assalamualaikum Tan Sri. Saya Azman daripada Sports Industry Coalition on Mass Participation Sports. We are I would say that we are the only industry that is first to close and don't know when to open lah. Because sports events ni memang paling susah. Tapi we have seen in Europe, sports event has opened. They did the events, they did marathon, they did obstacle race, cycling events. Tour de France did cycling event a few weeks ago, and we are wondering how can we get this happen. So we are ready to do like a test event. I mean in Europe also they did that. They did a test event so that they make sure that the SOP can be fulfilled. Any what you call this, kelemahan semua boleh diperbaiki before they decided to open for sports event. So we hope that MOH see this as because sport is good for everybody. I have a friend who is positive COVID, and then he suffered a lot, but after that he took up sports and he kind of getting better and better. So before he start doing sports, he was very the effect of the COVID tu masih ada kat dia. Tapi bila dia buat sports, dia recover lah. So we hope that MOH is very supportive in sports events or sports per se, and we see how we can open back this sports industry to every Malaysian, same like what happened in Europe and so on.
Yeah, actually, it's true. We are also considering to open up the sports event. But see, after the first wave yang kita laksanakan the PAC MCO 1.0, we open up all sectors, sports, everything. But the thing is that when there's after the election, then the virus spread like wildfire. We are not able to contain the virus at that point of time. Why now the spark down, the wildfire is easier to control when it's small. But now the wildfire is there, so that's the challenging part. Now, the solution now that we have, dulu kita hanya bergantung pada public health measures saja, tahun lepas. Now we have to depend on the vaccine. So now if the sport community already been vaccinated, then we allow them. For example, sekarang ni we are talking about whether they can badminton, golf, tennis, so we want to open up provided they have been given the 2 vaccination. So that's where I think the sports sector is coming in. I think we are more comfortable if they have been vaccinated. Kalau not vaccinated, there's a chances that they can get infected. Ini yang kita worried lah. Just like what we talked about the bubble tu lah. So the vaccination is the key now. So I don't want to depend so much on the public health measures. It's important, but to add on top of the public health measures, this is where we think that that's the solution for time being. We have 3 months lagging behind UK, etc. So we saw the Euro 2020. What happens now? 50,000 people infected every day in UK. But most of them got vaccination, and then yang meninggal baru 46, 50 people meninggal here. And hospital capacity ada lagi. Remember when they started UK early this year, their NHS system, the hospital semua penuh. Italy pun sama, Spain pun sama. Tapi sebab the vaccination, dia ada kemampuan lagi kat hospital. Itu yang data kita show. If you are vaccinated, you can get infected, but category 1 and 2. You can live with that category 1 and 2. Tapi kalau you are not vaccinated, you go for category 4 and 5, that probably you can succumb to the illness. And then boleh mati pun. That's why I think the vaccination is reduce hospital admission, reduce the usage of ICU bed, and also death.
Thank you, Tan Sri.
Thank you, Tan Sri. Tan Sri, if I could call Mr. B. Lau, he's actually from the Parkson Group, the Lion Group who owns Parkson. Mr. Lau, quickly, just before you start with the questions, can I just remind all the participants that the questions cannot be longer than the answers because we've got a lot of people that come here at a shorter period of time. So keep it very quick in terms of the questions so that we can actually hear out the solutions from Tan Sri. Mr. B. Lau, next to you.
Okay, see, in the absence of time, I would just go straight without addressing anything. So I had a question, number one. Now we have been in lockdown complete lockdown since June 1 until today. Since the lockdown till now, the number of positive cases continue to rise. And that also is in tandem with the number of death rate, right? Although vaccination is the answer, does the government have any plan B? Right, number one. Number two, based on the National Recovery Plan, there are 4 stages. And then in each of these stages, one of the criteria is actually the number of cases. So to migrate from EMCO to NRP to phase 1, fasa 1, the infection rate got to fall. From the National Recovery Plan 1 to Plan 2, right? To phase 1 to phase 2, the infection rate, the daily positive rate must go below 4,000. As it is, I don't think in the very short future we will be able to see any cases at that level. So are we going to perpetually remain at fasa 1 and then close our business indefinitely? Thank you.
Okay, very good question. So we have a look. We look into the vaccination rate, 10%, 20%, and then the 40%. Now we are looking into this. If you look into our reporting now, we are giving you the category 1, 2, 3, 4, and 5. Our focus now is 3, 4, and 5. Whereby 3, 4, and 5, you have to be admitted to the hospital. So eventually, now we are looking at 4,000 for the whole country. But for the state, now we are looking into 12.2 per 100,000 population. So 12.2, anything less than 12.2 per 100,000 population, then we can move to phase 2. Phase 2 to phase 3, 6.1 per 100,000 population. So that is in terms of the numbers. But we are looking now at 3, 4, and 5. So 1 and 2 one is asymptomatic, 2 is actually mild symptom. That is not our concern, much concern. Our concern is basically 3, 4, and 5, whereby you need to have the admit to the hospital, etc. So we may look into 3, 4, and 5 in time to come. But now we are sharing the whole category 1 to 5. But we hope that by vaccination, I've just shown in Labuan, by vaccination, from 1,340 cases, now they are reporting 20 cases, 22 cases, something like that. So they can even come down to single digit. So what we are doing now for Klang Valley is to ramp up the vaccination. Everyone should be vaccinated by maybe 21st of August. By 1st of August, 1 dose. Everyone should have 1 dose. Another 3 weeks, everyone is vaccinated. Then I think that the cases can come down. So that is our plan, looking into the whole scenario. This is not only affecting Malaysia, this is affecting the whole country, right? At least now we learn to live with the virus. The virus is in the community, we learn to live with the virus. You can get infected, but at least once you get infected, you are in a category 1 and 2. So that's the moral of what we are trying to do, living with the virus, then making the pandemic endemic. Endemic means it's around, but you can get infected. But just like flu, you get flu, you get a flu shot, and then you continue to live your life. So as long as it's not severe to be admitted in the hospital.
Thank you, Tan Sri. Tan Sri, actually the next gentleman who has actually made a lot of people laugh, Mr. Harid Iskandar. Quick one from you.
Terima kasih, thank you very much. DG, just very quickly, I don't know whether there are any press meetings today, but your message to me, correct me if I'm wrong, this is what I'm hearing. Current SOPs are no longer applicable. 1 meter distance, everything is airborne. The answer is vaccine, vaccine, vaccine. I think that this message to me makes complete sense. We need to get this message out there because everyone out there is focused on melawan COVID as if we can defeat it. I agree with you. We cannot defeat COVID. We can't be defeated. We need to live with it. And I'm excited about your suggestion about the bubble for not just Langkawi but for the malls, etc. I really feel that your message, for whatever reason, is not getting out there. What I'm hearing today is complete revelation to me. And if anything, I would love to have you on my show to present this message out to the people, got a live show out there. But what I'm hearing is, yes, you must get vaccine. And now with this so-called empty syringe syndrome, a lot of people are now going back to, oh, is this vaccine going to work, or should I even get a vaccine? Because there's a lot of perception out there, which is not true, but the perception is very strong. And I agree with you. Everyone needs to go out and get vaccine, at least 2nd dose, and then 14 days later. This to me is very clear, but I just feel that message is not out there. So thank you very much.
But can I correct you at that point? Because we still need public health measures. Even though you are vaccinated, you still need the public health measures. So let's learn from Israel, for example. They have really achieved herd immunity, then they relax the public health measures, no need to put on a mask, they can go, no need physical distancing, but you can see the surge of cases now. They have to go back to public health measures. So my take is that you need the public health measures, but not enough, but you have to complement by the vaccination. So we have to do both, not one or another. So vaccination is not going to replace public health measures. Public health measure is the prevention. Say the best prevention is stay at home, stay safe. That's the best prevention. If you're positive, you're not going to get infected, infect anyone. But if you're negative, then you're not going to get infected. So, but if you go out of your home, then you have complied with SOP. SOP is still a must. For example, double masking. You can decrease the transmission by 85 to 90% by double mask. Put on a shield. So sometimes the infection comes in like airborne, but you've got a shield to protect you. So protection is important. Stay away from crowded places, confined, poor ventilation. You stay away from that. And you take precaution, then you get, you can protect yourself from being infected. The chances of you being infected is less. Plus, in public health measures, is the external protection. Vaccination is the internal protection. You need both. so that you can get protection.
And just on that note, before you go, imagine a mall, imagine a shopping mall having all those measures you just mentioned, the double masking, and everybody is vaccinated and everybody's wearing masks. There could be a test case there where we can have this mall that is open, creating jobs, creating economy, keeping the economy going, where we are putting public health measures together with the idea that everyone needs to get vaccinated. Until that happens, we don't need to talk about anything else. But thank you very much for your time again. Thank you.
Thanks.
We have tried many times the owners to give it to the public to comply, but compliance is the issue now, right? Bazaar Ramadan, we agree, but you have to comply with the SOP, but poor compliance. See, that's the issue now. And then the caveat is to comply and enforcement. Poor compliance, poor enforcement, and then see the spread of infection. Say, for example, we have the SOP for Solat Hari Raya the other day, but you can see people are not complying. So when you do not comply, the infection comes in. People cheat. People cheat in terms of from the enforcement officer and whatever the SOP. But you cannot cheat the virus. The virus will take advantage of you. You cheat them. So this is the thing is that I mean the issue now is, do we have the full compliance from the public? If we have the full compliance of public, just like Taiwan, etc., they've been to war before. Very strict social discipline, social responsibility. Compliance is very high. You don't need the MCO at all. We need the MCO because of poor compliance. We say they cannot balik kampung. People are going balik kampung, more than 500,000 balik kampung. Say do not comply. That is the issue. 90% of us comply, but just because 10% do not comply, your whole mall, your whole system collapses because of that. Thank you.
Sorry, can I ask a very quick question, Dato, to Tan Sri? There are so many horror stories or videos showing fake vaccination. What can one do if after the blood test, where the antibody is very low? What can really we do? Because some of us we really suspect that we did not receive perhaps the second dose properly. So if the antibody level is so very low, what can we do to get a third dose, so to speak? Over to you. Thank you.
Thank you. I think it's a shame for us, like the healthcare workers, that it did not give a proper vaccination. I think we have black sheep in any discipline. I do not understand why the person did not give the vaccine properly. Initially, this was brought to our attention. We thought the video was distant, but very clearly showed that the vaccine was not administered properly. And that's why I think we are investigating, and police also coming in to investigate about this. So this is not only in our country, but many other countries are having the same problem again. Now, okay, that is different issues. That's more in terms of administering, did not follow our policies right. The implementation issue now. Maybe it's not many, but isolated cases, but even then has actually smear the reputation of the Ministry of Health, especially the profession, the nurses, and etc. So it's sad that this has happened, but nonetheless we are tracing back, because every vaccine that we give, we know the vial in terms of who get vaccine from which vial and etc. So we can trace back the person. Again, Pfizer vaccine is 0.3 mils, and then Sinovac is 0.5. So each time before you take the vaccine, you scan the code, and then we know the vial that they've been used. So now, in terms of the antibody protection of all the vaccine give you about 8 months to about 8 months to maybe about 1.5 years, and etc. So we are still monitoring whether there's a requirement for a dose, booster dose or not. So if you were to test the antibody is not there, then there's actually a question with regards to the vaccine and whether you need a booster and etc. So, but at the moment we do not need a booster yet. But the issue is you are not given the vaccine. If you are not given the vaccine, then there's no antibody. So, but whether we can prove that or not is very difficult unless we know that person did not administer the vaccine. Now the protocol is SOP is that each time you come in for vaccination, we'll show you in terms of the syringe that the vaccine is there, and then make sure that you observe the administration, etc. So we will try to improve the SOP, make sure all this can be, because of 1 or 2 person, and then the whole vaccination campaign has been smeared because of that.
Thank you, Tan Sri. Next is Dato Jawahar of the Presma.
Assalamualaikum Tan Sri. Terima
Waalaikumsalam.
kasih atas ruang ni. Kami saya tak nak ambil masa yang banyak. Terlebih dahulu kami ucap terima kasih lah atas program vaksinasi ni. Tinggal lagi Tan Sri, kami dalam satu kawasan kadang kami nak bawa pekerja kami, katakanlah dapat 4 orang dapat untuk appointment untuk vaksinasi, tapi dalam kenderaan sekarang ni dibenarkan 2 orang saja. Driver seorang dan 1 sepekerja je yang boleh. Mungkin pihak Tan Sri juga dapat bincang dengan PDRM dengan MKN kalau boleh diberi pertimbangan untuk membawa umpamanya satu kereta tu kalau ada 5 seater boleh bawa 4 orang ke Tan Sri. Sebab kami jumpa kat PDRM pun mereka pun kami jadi macam bola sekarang ni. Kalau nak hantar dengan Grab pun jadi macam isu sikit yang tu minta pertimbangan Tan Sri. Dan juga program vaksinasi di Selangor, di Kuala Lumpur, Putrajaya, Sarijaya ni memang alhamdulillah dapat panggilan yang agak fast jugalah. Tinggal lagi yang negeri-negeri lain belum lagi dapat panggilan. Dan kalau seperti mana saranan Tan Sri tadi, kalau dah semua ambil 2 jab baru akan dibenarkan untuk dine in apa semua ni, kami takut sementara masa yang anjal tu lebih ramai lagi yang belum tikar Tan Sri. Kami prihatin juga dengan untuk saringan jaringan COVID ni. Tapi mohon jasa baik dari Tan Sri jugalah. Satu, untuk membawa pekerja untuk pusat vaksinasi dan berikan keutamaan jugalah kepada kami ni ke frontliner di restoran juga. Pada saya, kami tak tahu siapa pelanggan kami. Begitu juga kalau di hospital umpamanya seperti mana Tan Sri sebut tadi, ramai yang kena, doktor kena, MO kena dan petugas frontliners. Kami minta ihsan daripada Tan Sri juga kerajaan untuk memberi pertimbangan untuk mempercepatkan vaksinasi dan juga untuk membawa pekerja kami ni ke pusat vaksinasi tadi. Sekian, terima kasih.
Terima kasih. Memang sekarang ni pun untuk Lembah Kelang, iaitu Selangor, Kuala Lumpur, Putrajaya, memang kita akan tingkatkan vaksinasi lah dalam tempoh terdekat sehingga 1 Ogos. Dan mungkin kita akan lanjutkan waktu vaksinasi sampai pukul 12 ataupun 24 jam. So kita dah cadangkan 24 jam. Jadi mungkin kesesakan tu kurang sikit. Sekarang ni pun kita bimbang, ramai sangat vaksinasi, tempat vaksinasi. Kalau seorang positif, ada kemungkinan menjangkiti orang lain. Jadi kita pun kena amalkan iaitu SOP semasa tu lah. Dalam kereta pun sama juga. Kalau seorang positif, 4 orang, 5 orang pun positif juga. Ini yang kita bimbang kalau dalam kereta je lah. Ini SOP MKN lah. Kalau perkara ni pun dibincangkan. Tapi kalau guna Grab ke, dia masuk 3 orang dalam satu kereta lah. 1 driver dan 2 passenger. Itu yang dibenarkan setakat ni lah. Tapi kebimbangan jelah dia jangkit satu kereta. Kalau seorang positif, satu kereta semua akan positif. Ini pun kita lihat sekarang ni, tempat pusat pemberian vaksin pun ada jangkitan berlaku. Kalau seorang positif, dia akan berjangkit. Yang ni yang kita bimbang. Tapi apa pun kita kena vaksin juga. Kalau nak cepat, sekarang ni kita dah boleh private, dah boleh dapatkan vaksin private. Mungkin kalau tak nak tunggu lama, boleh gunakan perkhidmatan private lah untuk secepat mungkin.
Terima kasih Tan Sri.
Thank you Tan Sri. Chris, you're next.
Terima kasih Tan Sri. Thank you Dato' AT and terima kasih Tan Sri for the time. My question is just very short. Towards the end of the vaccination, contoh kita dah habis vaksinasi the whole population, second dose by October, November. Kita masih ada lagi orang kata populasi yang mungkin akan kena stage 1 or stage 2 COVID. So ini bermaksud kalau kita buat saringan sendiri, kita boleh quarantine sendiri. Tetapi apakah akan jadi what will happen if let's say a person enter a restaurant, dia tak tahu dia fasa 1 ataupun stage 1 or stage 2 and he infected the whole lot of restaurant people and the restaurant have to close, quarantine dan sebagainya. That is restaurant. Kalau contoh kita buat event di Dewan yang besar in big halls and then suddenly what we call that one person is infected and then the whole hall have to close. So cadangan saya berbunyi sedemikian Tan Sri. Once we have vaccinated second dose, we keep on have to do self-testing or employer testing for all industry, and that test result has to be in the MySejahtera. Sekarang ni saringan suhu ni, I mean that the temperature screening is virtually useless because it's a lot of asymptomatic cases, Tan Sri. So I would, although it involve money, involve cost, but we have to work it out on how can we continue testing, and then we don't even take temperature screening, or we continue to take temperature screening, but we have to show our digital cert that we have been tested the last 10 days or 14 days, we are safe. Then we go in and consume the services. And then next 2 weeks, we do it again. So that is more of a public health measure that I want to propose over here when we reopen the economy eventually. Thank you, Tan Sri.
Thank you very much. If you look at the health sector, we do periodic testing. So we are already doing it for health sector. That's why you can see from 245,000 of our staff, 370 of them, 3,700 of them positive. Because why? We do the testing. Although they are asymptomatic, we are doing the testing as well. So we are encouraged. See, for example, those Malaysian returnees, we make sure that 3 days before they board, they take the flight, they have been tested, although they've been vaccinated. And then when arrival, we are still, we will continue to do our test. So the testing is important. So like Parliament, for example, now Parliament, we make sure all the member of Parliament is vaccinated. But we do know that some, because of the infection, or some other reason, they cannot be vaccinated yet, but they'll be tested. So these are the two things that we continue to assure that, even that you are, sometimes you do not know, you already been vaccinated, but you do not know you have been infected unless you do the test. So periodic testing is encouraged in factories, in the hub, hospital, we are doing it already, but whether your services are available, can do it. Now we have using a saliva, that's why I showed just now, the two companies. And one, probably you also can invest in the breath analyzer. So accuracy of breath analyzer is 98%. Within 2 minutes, you can get it. So, but now the issue is the supply of the breath analyzer. So if you get the breath analyzer, everyone come and see you, you do the test within 2 minutes, you get the results already. So, and then you know who is positive or who is not. So that is something that we can actually look into it. But now the issue is the supply. So there's a demand, but the supply is not enough at the moment.
Thank you, Tan Sri. Can I call Dato Gandhi from Asyas? Dato, quick one, Dato. Before I forget, I just want to remind everybody, I think the questions come with preamble. I think let's straight get to the question easier.
Thank you. Tan Sri, basically my question, I think you have answered a lot of questions. The key understanding I have is that for the business to open, especially, for example, our business is business events where international and local business meetings need to take place, that one has to have 2 doses and 2 weeks later. And then we could create a green bubble kind of environment for the business to start. So I think this is what I understand very clearly from what you are saying. So of course, there is a caveat about the new variant, but my thought is that we should not worry about, we should not worry about new variant until it comes, or we could have a plan B for that. But we should at least allow the industry to start based on science, working with your scientific answers and things like that. Another point that is very important is international. I think it's also very important to find a solution because we are a trading country. We are too small, like China or India. They can close the borders and survive. But for a country like Malaysia, the sooner we find a way to open up the international safely, of course, from green countries or those who are vaccinated with minimal quarantine. I think this is critical for us to survive.
Thank you, sir.
Thank you.
Very good questions. First is, when do we open up? So we look into other countries. Our coverage now, coverage of vaccine, although you have been vaccinated and then your staff been vaccinated, so that's already a bubble that you can actually open up. But the coverage now, ours is only 15%. Now, most countries, when they open up, is about 30 to 40%. So that's why when we started earlier, we are talking about phase 2 to phase 3, 40% of vaccination coverage. France, other countries are all about 30 and above, then only they open up. Now we are opening up too early. So that's where you see that when we open up too early, the consequences is 7 December. You open up too early. On 7 December, without the vaccine, you open up just using public health measures. You see the cases spike within 6 weeks. Then after PKP 3.0 in March, we open up too early because we are still having 4 digits and 3 digits. We open up all sectors really. Again, the cases spike. So now WHO said, do not rush to open up. But certainly your point is that when we reach 15%, 20%, if they can comply to all the rules, the bubble that we are talking about, then we can open up. Now the issue is, can we open up the whole country? I don't think we could. Maybe we start with Langkawi. Say, for example, you have a conference in Langkawi, exhibition in Langkawi. Make sure those coming to Langkawi already been vaccinated, but they are quarantined in that island. They are not supposed to go out of that island. So, and that island, everyone already been vaccinated. And maybe that's a hub that we can create. Likewise, Thailand is trying to create in Phuket. So we are trying to use Langkawi as one of the base to try out first whether we can allow. So the quarantine in Langkawi is not quarantine in your room, but it quarantine an island. So the island is considered as a quarantine center. So that's what we are trying to open up slowly. Does that work or not? See, for example, if we were to have the meeting in Klang Valley, then the infection can spread across very fast and we can't control. But in an island, it's much easier for us to control. So we are trying out this pilot project in a bubble for local and the foreign people coming to Langkawi. So if that works, then probably we can look into how we can create this bubble.
Sorry, just a follow-up question, because we have seen, for example, in Dubai, once they achieve about 50%, they are able to allow the international attendees to come. Of course, they have to come from green countries, those countries which has got minimal number of infections, plus they are vaccinated fully and all those measures. So I hope we could work with your science team to find a solution for this.
Yeah, if we can achieve 40%, we can see the cases going down already. So 40% is what we said earlier, phase 2 to phase 3, 40%. But now we're only 15%. So we are, considering even 20%, can we open up little by little? Sport sectors a bit here, a bit there, that we can control. But 40%, we are very happy. 60% in Labuan, you can see the cases from 1,300 to 22 cases and probably single digit in next couple of weeks. So I think that's where the coverage must be 40%, as you mentioned. In Dubai, probably 40 to 50% already. So once you reach 40%, most countries, Germany, Israel, UK, 40% cases goes down. So we are also seeing the same trend in Labuan. So that's why I think we hope that we can increase to 40% coverage.
Thank you, Tan Sri.
Thank you very much.
From retail service base to Dato Howard Chew, who's probably want to bring you to a real estate question. Dato, you need to unmute. I think you're still muted.
Good afternoon, Tan Sri. Okay, thank you for spending time with us. Of course, I believe real estate, we have around 50,000 workforce in Malaysia. Actually, real estate also same like car dealer, right? So we are by appointments, one-to-one. Is it possible that country can consider to open a bit for some? Because for example, nowadays the owner want to sell the property, they cannot sell. And also the car, some of them, they want to cash out, they want to sell the property to get back the money. But now they cannot do any transactions, right? So is it possible, Tan Sri, you can really consider about, we're also doing the property development. So even though our construction now all stopped, so of course it's impact to the construction site also, right? So maybe you need some advice from the Tan Sri about this case. Thank you, Tan Sri.
So my advice is now that initially everything comes under the shoulder of the government. But now you can actually get the vaccination from the private sector. So if you can get the vaccination private sector, that's one step. Apart from the SOP, then you can start your business once you are vaccinated. So we will allow, if your say your sectors, 80% 80% of them been vaccinated, then we can continue to open up 100% really. So that's what been suggested. So now, 3 vaccines available. You can get it from Pharma Niaga, that is Sinovac. Sinovac is also, and Pharma Niaga is also applying for the dossier for Moderna, that is actually equivalent to Pfizer. And Sinopharm from Go Pharma, I think the company, also been approved. So 3 vaccines can be available for the private market. So if you can actually speed up your vaccination in your company or in your sector, then you can open up as soon as possible.
So can we apply to through MITI, right? If let's say all our staff getting vaccinated already?
Yeah. So MITI will, MITI is actually under the government because you need 40 ringgit. But now we are opening up the private sector, whether the state or the factory you want to buy, like say example, one company, Genting, they have the money to buy their own vaccine for their staff. So they do their own private vaccination. So that can be encouraged, and then you can you start your business earlier and faster.
Okay. Thank you, Tan Sri. Thank you.
Thank you, Tan Sri. Thanks, Dato. Can I call upon Inche Charo from Matfa?
Hi. Thanks, Dato. Assalamualaikum, Tan Sri. I'm from the Malaysian Association of Theme Parks and Family Attractions in Malaysia. Obviously, with the relaxation for those with 2 doses in the future to travel inter-state or inter-district, that would mean potential visits to leisure-based entities. So perhaps not a question, but to seek your support to get tourism industry players. There's 3.6 million of us to be vaccinated, just like other industries as well. While we are very clear, as what you've mentioned about the airborne concern, perhaps both parties can also work closely to determine a better or much aggressive SOPs to allow these businesses to operate. Currently, even we are operating with a 50% reduction in capacity. We are just happy to operate so that the business can sustain itself. And the last, probably a small question that I would want to ask, are there any studies from KKM in terms of determining the efficacy of chlorinated water against COVID-19? Because a few industry players has forwarded us some studies from abroad saying that at some stage it is something that is being looked at, and it is in fact effective in killing the virus. Not quite sure on that, but just wanted to check, yeah?
The second question, probably there's no evidence to suggest chlorinated water can kill the virus. So that's one. Then the second is that in terms of leisure travel, we are looking into seriously. But the hoteliers, for example, they must also be vaccinated, the waiter and etc. So so that they can actually be protected. And those going to the hotel, this is what we suggested, that if they vaccinated, they can actually attend to visit the tourist spot and hotel, and not a problem. So this is what we have been suggesting. But now the issue is the coverage. Tadi mentioned coverage 40%, ada yang 30%. So our coverage, whether it's a 20%, want to push down to 20%. So it's very risky to push down to 20% of coverage. If the coverage is 40%, then we are very happy that actually we can actually open up more hotels and etc. So at the moment, I think we have not closed any hotels. But the thing is that nobody is coming to the hotel because of the lockdown and etc. So if they get 2 doses of vaccine, and then they probably can visit and then can visit the theme park or your hotel and etc.
Thank you, Tan Sri. Since you mentioned the hotel, can I ask Mr. Yap from the Malaysian Association of Hotels? He's the CEO. Mr. Yap, quick one. Yes.
Thank you, Dato. Thank you, Tan Sri. Good to see you again. Just quickly, I've got 2 questions and 1 suggestion. The first question is that what are the chances of vaccinated persons infecting another person?
Very good question.
Yeah, supposedly it's supposed to be low. So the second question also related to that. Now that we know that it's actually safe in a way for vaccinated persons, has a low risk of developing serious symptoms, what is still needed? What are we waiting for to allow closed ecosystems? Example, shopping malls. If let's say everyone in there is only vaccinated persons, or a hotel only allows vaccinated persons, what are we waiting to allow that if we already know that vaccinated persons are safe? So that's the 2 questions. The third one is a suggestion. we need to enhance the MySejahtera check-in to actually filter out the vaccinated persons. Example, there's a separate check-in that only allows vaccinated person. Anyone who's not fully vaccinated will be rejected entry. I think that would be a good system moving forward, living with the virus. Thank you, Tan Sri.
The third question, I think that's exactly what we're trying to do. Once we implement, for example, then the MySejahtera we will modify so that you know, check in with MySejahtera whether they're really vaccinated or not. If you look into your certificate, there's actually a barcode there to show you that you're really vaccinated or not. Then the first question is regards to, if you have been vaccinated, can you transmit the infection? Yes, you can, but the chances of transmission is very low. Why? Because once you are vaccinated, your virus load is very low. So when your virus load is very low, the chances of you to infect another person is actually very low. And look into our healthcare workers that been infected, about 3,700 people, and we look into their CT value. CT value is important. If the CT value is low, then the risk of transmission is very high. But majority, more than 50 to 60% of CT value very high, which means the transmission is very low. So that is actually been proven by our data. So maybe I would say that once you're vaccinated, your transmission to another person may be less than 50%. That's number one. So if you are not vaccinated, 100% transmission you can occur. Second is that yeah, we are looking into individual, but the coverage, we mentioned about coverage. If we reach 40% of the population really been covered, so we are very happy. But now only 15%, 15% been covered. So that's why we are waiting for this coverage of the population. At least probably the data that we see from other countries is 30% or 35%. So if we can reach 30 or 35%, then probably we can open up. But now we're only 15%, so it's too soon for us to rush in and open up. So that's to answer your three questions.
Tan Sri, I kind of empathize with you because I think every 2 weeks they close their hotels, they lose about 300 million ringgit. Can I take you from the hotel to the restaurant back again? Can I have Mr. Krishnan?
Sorry, Dato. Can I add on the hotel?
Hello.
Charudin here from Maho.
Hisham, can you give me 1 minute? I'll get back to you.
Okay. All right. Thank you.
Okay, thank you, Tan Sri. Thank you, FMBA. Actually, we are very small and medium restaurant industry, Tan Sri. So most of our restaurants, our staffs are between from 10 to 20. So these people actually, among these workers are almost like 50% or above 40% are foreign laborers. So they are lining up to get their opportunity for vaccination. But in Sejahtera, I think, I don't know whether it is set up as such or foreigners are given later. But most of these workers are not able to get, vaccination ASAP. But even when we go to the PPVs, try to register this, either to refuse us to register or wait, told us to wait. So maybe it can help us, because the restaurant, our restaurants are not, everybody talked about restaurant, but the small restaurants should be given little, opportunity to get vaccination ASAP, because see, our competitors are now open everywhere on the streets without SOP, and so much of SOP has been compromised on the streets, small outlets open without any licenses and any compliances, any health requirements. So those are our competitors. We can't fight them. And our type of restaurants still waiting to get this vaccination. Please, if you could help on these measures, these restaurants should be somehow given a little opportunity to get the vaccination, even though they're foreigners. That's only my recommendation. Thank you.
True. So now you see there's issues with regards to citizen and non-citizen. So do we give the non-citizen first and the citizen is still waiting? So this is again very sensitive issues that we have. So the waiting list now, many citizens are still waiting. If we were to give the non-citizen, become an issue. So this is why I think we have to prioritize. So we need to clear the list first. The citizen waiting list is about 15 million people are still waiting to be vaccinated. So, okay, I understand the restaurant. Again, some foreign workers and etc. So priority may not be given to them now. More so they are non-citizen, but it's important for them, important for your business. So maybe you invest in the private PICAS, for example. So PICAS is trying to get for the economy sector. So either you contact the MITI and PICAS, or private vaccination. Say for example, if one person vaccination, because he's charging about 40 ringgit, maybe like one person about 100 ringgit. So you gave 22, you got 20 workers, you 100 ringgit per worker. You invest in your worker, straight away you can open up your restaurant. That's what I'm trying to say. To speed up now, everyone is depending on the government. The government waiting list is long. The line listing is long. So to speed up the whole process, if you can get the option now, got 3 vaccines now, Sinovac, Sinopharm, and Moderna. Moderna probably on the 5th of August we will approve it. So you got 3 vaccines to choose from, and then you can open up your business as soon as possible.
Thank you.
Thank you, Tan Sri. Can I just, Mr. Shahrudin, just now you mentioned something, sir. You want to add on quickly? You're muted. You're muted.
Okay. Assalamualaikum, Tan Sri, Doctor. Hope you're fine. Selamat Hari Raya Haji. I just want to add on the healthcare sector on top of what Yap has mentioned. Actually, we hotel is one of the worst hit among the businesses. And even though we are allowed to operate, but we actually not really can operate when you tell us you can open, but no guests can go in and so on. So I think the best thing to do is, firstly, we have to get all the hotel employees vaccinated as soon as possible, because we want to start our business and operation as early as possible, because no hotel can sustain any longer. Another 1 or 2 months, maybe more, we close, and we'll be almost quarter of the staff have been terminated and so on. So if we do open in October or January, there's no more facilities up to the standard and the manpower to serve the industry. So what I am suggesting is we identify maybe states which having maximum vaccination rate that we can open in the tourism and hotels, and get all the hotel staff to be vaccinated, so we can open location by location. I mean, we select. We don't have a lockdown for the whole nation, and we don't identify the whole nation as open, but we identify where the location. Right now, maybe Kelantan or where they have very small case or incidents of infection, and we have about 70% of the people that are vaccinated. We allow these kind of places to have tourism. So allow the interstate travel with the people who are already vaccinated, and maybe with the booking or hotel confirmed, so that the hotel can survive. Because now,
if we wrap up,
so that's why I'm suggesting that can MOH also can together with hotel we have requested to do the vaccination for hotel employees fast, and also we identify the location where we can open, where the vaccination has been done to the maximum, so that we don't suffer any longer. Okay, thank you.
Okay, now what we are doing now is for Langkawi. Since Langkawi, we are vaccinating 3,000 people a day. So we hope that within 20 days, we get 60,000 people, hoteliers and all that in Langkawi. Once they are vaccinated, we open up Langkawi as soon as possible. Then next also suggestion of Pangko, for example, if we can step up the vaccination in Pangko and etc. So once the hotel staff, everyone is ready to be vaccinated, then they are ready to accept the tourists in. So we hope that we also allow interstate travel. Once they are vaccinated, they can go to Langkawi and etc. So Langkawi will be our test pilot project. So we hope that it works. Now, if Langkawi works, then we'll open up other sectors. Like Genting also suggested whether they can open up, they can buy their own vaccine, but they vaccinate everyone in Genting, then they only allow those vaccinated to come to Genting. So that's how I think we can open up the sector bit by bit, using the vaccination plus the public health measures. Thank you.
Okay, very good. I hope you can help to push vaccination for hotels as soon as possible, because we cannot wait until October or November, December. So we can start early as possible. That's the best. We can start our business for tourism. Thank you.
Thank you, Tuan. Thank you. Can I call Tan Sri? I'll take you to one more peculiar industry, Dorothea from the spa industry. Dorothea, quick one, please.
Thank you. Hi, Tan Sri. I'm from the presenting the spa and wellness. As you can see that we are in the negative list this time around. So we were just wondering if we are in the negative list, and we have actually gone through the criteria of being in the negative list, and we are also wondering, because in the hospital under the unit Perubatan Traditional Complementary, all our pengamal is actually putting on the PPE. So we're just wondering, like outside, like we understand building alone, most of our members are registered with MOTAC. We are, we have about 600 of our members, and then all of us are actually also have submitted our names to be vaccinated because we think that we can help out, in terms of mental wellness. So appreciate if, let's say, Tan Sri can enlighten us whether or not we can actually, to be open at least from both association that is registered under MOTEC, because I myself is serving the additional complementary medicine unit in the hospitals, and we do massage for post-stroke, and it's quite.
I need to everybody.
Okay, thank you very much. So now we already put up the proposal to MKN for the traditional and complementary medicine. The other day, the proposal will be submitted, but again, we're going to improve the SOP. So we are going to resubmit again so that, acupuncture, massage and all that, we can come in, chiropractor and etc. So I think we're going to submit maybe this week. I think Dato Sri Vikasiong also have actually looked into the implementation of the TCM SOP. So we'll improve the SOP to allow one-to-one, and then the few SOP to be complied with, then probably the sector can be open.
Thank you, Dato, because we are hoping that the two associations registered with the MOTEC, we have about 600 members. We will be very, very grateful if, let's say, we can push that members, because we are very confident of the, of our SOP, which has been submitted to MKN. Thank you. Thank you so much.
Can I have Mr. Alvin Low from PAMM? Alvin?
Hi, good afternoon. Thank you. I'm representing beauty industry. So we have put up the PCAS for the beauty industry. So we wonder that is any possibility that we can spread out and help the government work together for this industry to vaccine, and then we can help them to do those. So at least we can spread out and let the industry continue to operate. This is very short. Since my question, a lot of people have been asked. Thank you. This is the.
So we have already opened up the opportunity for your industry, private vaccination. So if you can go for private vaccination, then probably you can speed up the opening rather than waiting for the government vaccination list. So that's why now, before that, there's no option. You need to wait for the government. But now it's available. 3 vaccines available for the private market. From August onwards, I think you will get it. So if you can make the private arrangement, there will be a payment, there will be a fee. But it's worth it. You can actually, get the vaccination early. So there's no queue in terms of if you get the private vaccination. So I think that's the way forward to help us. So if the T20 or some industry can speed up the vaccination using the private sector, and then probably at the end of the day, we have more people being vaccinated. That's the most important. More people coverage vaccination in this country. Then we can opening up more sectors.
Thank you. We will do that. Thanks.
Thank you, Tan Sri. Tan Sri, just one more. I've got one more couple of. Yazid, you're still on?
Yeah, I'm here.
Yazid, quickly.
Assalamualaikum, Tan Sri. Thank you. I just want to qualify. Do you agree with the statement that the factories are not to be blamed anymore due to this large number sporadic? Number one. Number two is, do you believe the Akta 446 compliance with regard to where they stay is an issue that has not been resolved, and that the fact that they are not compliant has aggravated our attempt to ensure the penularan itu terhad? That's number two. Number tiga, rasa-rasanya sekolah bila boleh buka? That's also adding mental pressure to a lot of people at home. Thank you.
Okay, the issue is a factory. It's not the issue. Same as I just informed the hospital. 56% of the infection from the hospital is from the community. Likewise, the factory is the same thing. So now we are looking at the whole ecosystem. Maybe the factory follow the SOP and etc. But the workers goes back home and then they do not comply with the Act 446, and then very congested accommodation, etc. get infection. So once they get infection and then they go back to the respective factory, and especially managed by third-party organization. So in Klang, for example, third-party organization provide the workers. The workers not belongs to the company. It belongs to the third party. So today they work in the factory A, tomorrow they work in factory B, and etc. They continue to spread the infection from one factory to another. Why? When the accommodation is not being addressed properly. So this is where we see the issues with regards to the infection spread in Klang, for example, because of the common user workers from one factory to another. And this is alarming because by, they do not have the employer and employee relationship. They only have employer and the third party providing the manpower. So that's where I think we need to look at the whole ecosystem of the workers in terms of the safety of the workers.
Sunil, you had one more question just now. Not there, and Tansri, we are more or less. Tansri, actually, there are some questions in the chat group. If I could summarize just one or two, I think quite a number has actually asked your stand on ivermectin.
Okay, ivermectin is actually an old drug, and it's an anti-parasitic drug in 1970. So far, I think after more than 40 years, there's no patent. It is a drug that actually have antiviral effect. Now, when you use for anti-parasitic, you take one dose saja, ubat cacing, makan sekali saja. But now you're taking it for this COVID-19 for a longer period of time, and to get the antiviral effect, the dosage is much higher. So now there is actually a side effect of ivermectin, especially in terms of the fits, ataxia, GI symptom, rash, and etc. Not be mentioned, but the side effect. So what we look into the data that we about ivermectin, it is an antiviral. Likewise, when we look into hydrochloroquine and even anti-HIV drugs, Calestra before, they are all antiviral. But now it's proven the anti-malaria drug HCT and Calestra anti-HIV drugs have no value in management of the COVID-19. COVID-19 is a new virus. So whether this old drug effective on the new virus or not. So the data that we have actually is a mixed data in terms of ada yang kata effective, ada yang tak kata tak effective. So what we are doing now is we already started a clinical trial to look into the effectiveness of ivermectin for severe disease, for example, and progression from category 3 to 5. So hopefully we get the data in time. We are collecting the safety data. We are collecting the data efficacy in our hospital. Now, those who want to use ivermectin in the hospital, we allow under NPRA, we allow, but you must apply for off-label use. So that you continue to monitor. The issue now is that those who have not been vaccinated, they take ivermectin, prophylactic. Before you get infection, you take prophylactic. That have no enough data to substantiate, and also we are also worried about the side effect. So now I think we have two clinical trials. One looking at the severity of ivermectin to stop the progression of the disease. The other is that looking into prophylactic, whether we can use ivermectin for prophylactic. So we are doing the clinical trial first before we can make any conclusion. Thank you.
Thank you, Tantri. Datin Sunil, if you're there, otherwise Datin Maheshwari, I think you made quite a number of comments. Maybe one question to Tantri. You're muted, madam. Datin, you're muted.
Thank you, Dato. Good evening, Tantri. Actually, I'm representing the textile sector, textiles retail sector. Actually, most of the hypermarkets are already allowed to operate. I mean, their textile sections are allowed to operate, but the retail textile shops are not allowed to operate. So we find it a little not consistent. So a lot of our members are asking this question: why is it being an unfair deal? And what we are suggesting is, if at all, because if we are open, it should be open altogether, right? So that's a thing. And another thing is, if we are vaccinated, at least about 50% of our staffs are already vaccinated, can we open up to operate? So like just now, the Langkawi and all the other cases that Tantri has suggested. So at least 50% can we start operating instead of fully vaccination? So how is it if one dose is allowed? And another thing is the self-quarantine, sir. And what's happening is a lot of people are not practicing the self-quarantine effectively. Some of them are lying by wrapping up their banks and things like that. So maybe what we should do, like MCO1, there was a case where we opened up all the halls, because nowadays there's no events going on. So most of the halls are empty. So maybe some of these halls can be used as quarantine centers and make sure that these people are quarantined there instead of self-quarantine. Maybe that can help to stop the spread. So this is my second suggestion. And the third one is on consumer education. Consumer education on the vaccination is being done, but a lot of people don't know that they also have to take care of their immune system, and they can be actually infected even though they are vaccinated. So I think there should be some great emphasis on consumer education, especially in the media. Thank you, Tan Sri.
Thank you very much. Certainly, I think very important is education. Try to educate the public what the do's and don't, especially when it comes to this virus now. So this virus, as I said, those days was droplet. Now it's already airborne. It's been reported airborne. So we have seen how it can transmit from one person to another by video camera. 15 seconds only, without even coming near to you, no touch, but then you can get infected. So that is the message. So we need to take care of ourselves in terms of to protect ourselves. Then you look into the vaccine. If we have the first dose, only one dose, your protection is 33%. So it's very low. So which means we also have 232 people died after the first vaccination. So first vaccination is equivalent to no vaccine at all, because it's not good enough to protect you from the Delta variant. So I think it's important to have 2 doses so that you can step up. So now 50% is not good enough coverage. You need to have at least 80%. But why? Because the infectivity is high. When the infectivity is high, 70% of coverage is not good enough. You have to go for 80% or above. So if you can reach 80% and above, then we can open. Retail, yes, we are really discussing to open up the retail, but make sure the the staff in the retail sector already been vaccinated, and the customer coming in also been vaccinated. So this is already in our planning to open up the retail sector. But again, the timing of to open up, because the cases are in the acceleration phase. So once the cases is in the deceleration phase, downward trend, then probably we can actually consider. So it doesn't make sense to the public when the cases goes up, you open up more. So that is actually a no-go. So we hope that we can decelerate our downward trend of the cases documented daily. Then probably it's time for us to consider. Again, learn from the mistake. Opening up too fast, you end up back to square one again.
Thanks, guys. Tan Sri, okay, we're more or less at the last lap. I would probably want to take up too much of your time. Just quick, maybe 1 or 2 questions before the last question comes from Dato Abdul Malik himself. Anybody in the group probably wants to shout out one major question to Tan Sri, so the loudest gets the chance.
Dato ATK.
Dato Subra?
Yeah, Tan Sri, the only thing is most of these problems is because of the inconsistency and distribution. You give to some places, they look like there's no law and order. Somebody knows somebody, they get it. Some hotels in some states have got it, some other states. I represent the Malaysian Association of Hotels. So there's no system, there's not much procedure. The government is doing a lot, we appreciate that. But it's not systematically done. It's whom you know, it's how you do it, whom you know, this is the thing that's causing the problem. So I request Tan Sri to have some kind of systematic, which is fair to everybody, not give to somebody who knows somebody and leave the others out. Thank you, and I'm very happy that you're paying attention to tourism. Hotel industry is one of the biggest contributors to Malaysia. So during tough times, don't forget us, because we have been all along taking care of the coffers of the country. Thank you, Tan Sri.
Thank you very much. So again, I'm not in charge of the vaccine. I just put it clear. I'm not in charge of the vaccine. I'm in charge of NPRA. So conflict of interest. If I have to sit, I approve the vaccine, and then I sit in the vaccine to actually promote. So I don't sit in the my deputy is sitting in the vaccine group. So the vaccine group can also look into the implementation of the priorities and etc. So now the issue is the priority. How do we prioritize? So it's been discussed in the committee, CTIF and etc. Certainly now I think if we were to balance health and economy, not have other sectors economy. So if economy is very important, then priority should be given economy as soon as possible. And also especially in the red zone area, red state and etc. So I think this is a priority being decided. Again, everybody wants the vaccine. Remember, when we bought the vaccine, nobody wants the vaccine, and there was actually a call for all the member of parliament and to go for the vaccine first before the public, because the trust in the vaccine is not there. But now you can see that the trust in vaccine is increasing because we have 3 months gap to look into what UK is doing. So everybody wants the vaccine at the same time. So now I think it's the priority. How do we step up the vaccination? Now we've got a public sector, we've got a private sector, and hopefully by public and private, because the healthcare is dichotomous here, public and private. So now we allow the private sector to come in so that you pay a fee, but you get the vaccine early. So now, and the public sector already bought 48 million doses. The vaccine is coming in. So we hope that that's also enough for us to get a booster in time. And the other age group, the 18 years and below. So after we have vaccinated all, then you can walk in. We also will be considering those 18 years and below, especially 16 and 17 years. And what about 12 to 15 years old? So that also a high risk group, you will consider the vaccination. And we also must need to look into the party, especially in Sabah and Sarawak. Pendatang asing tanpa izin. So we are looking at a single shot vaccine like CanSino. I mean, we go to a pendalaman or even to the border, and then for the party also you need a single shot of vaccine. But at the end of the day, we want everyone in this country to be vaccinated, as high as 80% or above. So if we can achieve that, then hopefully we can see what's happening in UK 3 months ago. And now probably learning from their experience, but do not make the same mistake. They are opening up without social distancing, without physical distancing, putting on the mask. We still have to maintain the public health measures and increase the vaccination. Then I think that's the key for us to recover in time to come.
Thank you, Tan Sri. And Dato Malik gets the last bite before Dato Ira wraps up. Dato Malik.
Okay, thank you so much. Well, Tan Sri, I just want to say two things. One is, of course, we are very thankful that you have made a very beautiful and very detailed clarification, because members of the industry captains are here, and we feel very sad when people are not appreciative, keep blaming the government about kerajaan gagal, things like this. When you and I know we're talking about rakyat gagal when they don't follow SOPs, when they still want to balik kampung, when they curi open their manufacturing factories behind the door, they change their signage, they bluff license, they take fictitious certificates, but everything is blaming the government. So we are trying very hard to make the people understand the government is doing the best. We fought with the government to ensure that the private sector was given the vaccine, and now the government has agreed to give the private sector the vaccine. When we fought for a lockdown, the government gave us a lockdown. So if I can say safely, our organization has been around since last year. Many of the things which we have asked for, including, I go off track, moratorium, which we wanted, you cannot get 100%, it's not possible, but we have achieved 70 to 80%. That's one, we are thankful to you. So at least people get a better view of what the government is doing. Number two, I hope the KKM also will focus on the mental health, especially 18 months locking down people, children, students, university students. I hope some impact or some focus is been done to address these groups before they go into depression or commit suicide or having more family issues, husband-wife issues. So these are my 2 points. Thank you, Tan Sri.
Tan Sri, do you want to?
Okay, thank you very much. I think your points are well taken, and more important, Ministry of Health, we are trying our best to save life. That's all. And we all know that we are the last line of defense for the country. If we fail, that means the whole country will fail because the infection will spread like wildfire. So I think the support. Sometimes I get criticism. I think I'm caught in politics as well. Both sides. I mean, attacking us left, right, and center. But again, we are here we are apolitical. At the end of the day, what we want to do is to save the country. Every one of us have a responsibility. So to say that, I think mental health, I think there's a lot of pressure on us in terms of, because this is a prolonged period of time. Everyone is affected because it's already 18 months we have been into this. So again, if we, I think the intention is very important. The sincerity is very important. If you go to a war, you sacrifice your life actually to defend the country. Likewise, the healthcare system now, this is a war, and every one of us actually, mental, physical fatigue. But at the end of the day, if we fail, then the country will fail. So this is why I think rather than fighting against each other, why can't we be united and fight a war together? This is why we must work with the economic sector, health sector, understand why we are doing this, understand what we should do forward, and this is where the engagement comes in. If all of us have one vision to end the pandemic, we are not good. I mean, it's not a matter of health versus economy. No, we are trying to balance the two. We must come together to fight the virus together. How can we actually work together with all sectors to end this pandemic? That is more important. It's not a matter of a health sector fighting against the economic sector. So sometimes we are caught exactly like, one sector against each other. But at the end of the day, I think this is not only affecting Malaysia, but the whole world is facing the same problem. So we need to learn from others and see how best we can, mitigate and recover as soon as possible. But from the ex-DG of World Health Organization, Margaret Chan, he just called me yesterday and said one thing: pandemic doesn't last forever. So this is a short period of time. So we need to brace this storm together, and hopefully once we can end this pandemic, the recovery process will be very fast. So we have seen this during 100 years ago in 1918, for example, after the Spanish flu. The recovery is very fast. So again, be prepared. That's why I said be prepared, get ready, and then work together with Ministry of Health, end this virus as soon as possible. Once we can end this, create a bubble, and we can start the economic sector again. But we are also worried because there is a possibility of this new variant again coming. So what variant coming in December, I don't know. But if there's a perfect virus, for example, not detectable, high virulence and also high transmissivity, then we are back to square one again. But more important, the virus is continuing to evolve. We must come together, be united, and fight this virus together, rather than blaming each other, calling names of each other. And we are fighting among ourselves rather than fighting with the virus. Our focus is the virus, not among ourselves. So we shift our focus now, our war, to a different group. So I'm caught in between. That's why sometimes in politics, we are caught in between. But we are apolitical. We just want to do our best for the country.
Thank you, Tan Sri. Just for our wrap up on our side, can I call Dato Maidin? Dato, you are muted, Dato. You need to unmute. Yes, yes.
I'll just do a quick wrap up, Tan Sri. First, a couple of questions that have not been answered. I think we need to answer those questions. Number one, the question from the floor was the inconsistency of SOPs. That question has not been answered. All right. That means why, for example, Maidin is open. We have a bigger apparel session, probably than Sogo, if I may say, but Sogo cannot open. All right, because we are in hypermarket and they are in a departmental store. I'm happy that I can open, but I'm not happy my other colleague cannot open. That means this is very inconsistent, and I think this must be straightened out. I mean, that thing just not mentioned, but maybe she's talking about small shops, but we're talking about shopping centers. We fail to understand. We fail to understand this inconsistency. We need an answer. Maybe it's from MKN, but if Tan Sri can bring it up for MKN, because MKN is, I mean, Tan Sri has come here to talk to us. Thank you very much. We will never get MKN to talk to us. All right. They don't want to talk. They're hiding behind a shield. The shield that you want us to wear, but maybe they are wearing it. I think that could be the problem. Okay. So number one, we need to be consistent with the SOPs. Why apparel and this cannot open and some of us can open, number one. Number two, similarly, the SOP is clear. Kedai pajak boleh buka, tapi kedai emas tak boleh buka. Someone need to explain to us in businesses why. Why kedai pajak boleh buka? Because kedai pajak, you go there, you give your gold, and you get money in return. In a goldsmith shop, you give your money and you get gold in return. SOP is exactly the same. Tan Sri keeps telling us, SOP, SOPs. SOPs are the same, but why we are not consistent? My third point will be, you allow people to go for walks 2 people, but you close down parks. Also another inconsistency, and which we all cannot understand why someone cannot just say, sorry, we made a mistake, parks can be open. You need only one guy to walk around to make sure people follow the rules, because we walk every morning, we're getting old, but we have this thing about walking on the road and in potholes in Malaysia. Okay. I think the overall arching thing is about getting vaccinated, and we all agree. So we all retailers have lost hope now that we will not be opening our businesses for August, in August. But I need 2 things to be done, Tan Sri. Number 1, you mentioned get vaccinated, fine. Can we have an SOP out there? Somebody to announce this very clearly to all of us, not a conversation that we are having here, although I know it's recorded, all right? And clear SOP, come out with it to say, whoever is vaccinated, whichever hotel is vaccinated, whichever staff, my store, 8,000 staff, almost everybody has been vaccinated. Almost everybody. So wherever I have got double dose vaccine done, I can open up 100%, for example. There are restaurants that have been vaccinated. I've got my double dose. Can I not go and have dine-in? So where is that SOP? I am very clear you're mentioning it, but we need a SOP out there. Then all of us will work towards that goal. Any small restaurants, all the staff vaccinated, anybody coming with double dose, makan. So we need that. So can we get that done? Number 2, Tan Sri keep mentioning private sector is open, just pay for it. I think all of us are more than willing to pay for it. But why do we have to have centers for retailers? Go to Sogo. For this one, you go there. This one, you go there. What is so difficult? Just have your centers. Whoever wants to go wherever, now that it's going to be open and it's private, pay 100 ringgit per whatever. These are the places you go. Our friend here can go there with 50 people, register today the 50 people, given the date, and day after tomorrow, they can bring the 50 people there. It is not being done, Tan Sri. It is not being done. You can say whatever you're saying, Tan Sri. Okay? PPV, some of the vaccination centers are begging for people to come. But the first question, are you a retailer? Are you this? Are you that? That's the hindrance. Open it up. Yes, limit it to maybe, I don't know, whatever numbers. We will pre-register. Go there, give our numbers, and then we can go in. Then only what you say is going to work all over Malaysia. And I've been told vaccination is very slow in East Malaysia because there's not enough places. I'm not sure, but that's what I've been told. So maybe we need to move that side also. But I understand you're going to do Selangor first and then move forward. We understand, Tan Sri. Thank you, Tan Sri, for coming. You are our savior. We appreciate whatever you're doing for the country. Thank you.
Thank you, Dato Wira. Tan Sri, since Dato Wira mentioned Sogo, I must get Raymond Teo just to say thank you to you on all of behalf. Raymond?
Yeah. So good afternoon, Tan Sri DG. I, on behalf of FMBA and also Sogo, since Dato Wira mentioned so much promoting Sogo, thank you very much, Dato Wira. And yeah, we like to say thank you very much, Tan Sri DG, for your time. We know your schedule is also very busy, so we appreciate very much, okay, for also sharing with us all the information about COVID in Malaysia, the situation. I think now every one of us here, 100 of us here, we are, I think now more enlightened, okay, more enlightened as to the situation. So we thank you very much for that, and also thank you for all the feedback. I mean, more positive than negative. But I think more importantly is that, like what Tan Sri you share, I think the engagement between the government and also the rakyat, especially the business community, I think is very, very important. I think for us to understand each other and for us to actually work together, like you say, to actually overcome this pandemic. So with that said, I hope that we can have more of such engagement even with other ministries, and we can actually open up more and more sectors, and especially the retail sector, because we already been locked down since 1st of June, already more than 1.5 months. I think no company in the world, no matter how big, how small, been locked down for so long with no revenue, but with expenses to pay, that you can actually stay afloat. Really. So actually, that's why we are trying desperately that we need to open up. I mean, gradually. And I think nobody mentioned, I mean, throughout these 2 hours, I mean, we appreciate very much your time, 2 hours. But for those sectors that have been locked down, and especially those in the negative list, I think for more than 18 months, we hope that Tan Sri, can you please, I mean, on the government side, help by, by extending the assistance package. And it doesn't have to be a one-size-fits-all, because we know that some industries are locked down longer than others. So those industries that have been allowed to open, whether partially or fully, the assistance can be less. But the assistance to those industries that have been locked down for so long, okay, can assistance be more? For example, like I just give an example, the wage subsidy program. Okay, I mean, we appreciate very much for the wage subsidy program, but I think for those very big companies, it's just about 5% of the wage, the payroll cost. It's just 5%, and it's like drop in the ocean. So what I'm trying to say is that for those sectors that have been closed for the longest time, can the wage subsidy be higher? For them, let's say maybe up to 70–80%, like what the other countries are giving. So at least they can sustain. For those who are open, it can be less. So it doesn't have to be a one-size-fits-all. So I think that's all I want to also add as a closing remark. And also, thank you very much again, Tan Sri, for your time, and we appreciate very much. Okay, thank you.
All right, maybe I answer a few questions here. One is, what about Sabah and Sarawak? Sarawak have been given the vaccine, so they are among the state that actually achieve. I think they will achieve herd immunity, or even 70–80% of the population soon. And you can see that when they reach about 30% plus, the cases are going down in Sarawak. Now, Sabah is the issue now. Sabah is actually been delayed. Why? Because we are waiting for the single dose vaccine. Because Sabah, there's a lot of issues with regards to undocumented migrants. And because of that, we are waiting for 10 Sino vaccine that we will give 1 dose and that's it. No need to come back for the second dose. So that's why I think 1 million doses will be given to Sabah this month. And then hopefully we'll speed up the vaccination. So you don't need to do twice vaccination, only once. That's why we are, especially the border, Pulau Omahal, Sempurna area. So it's a very security area, and then we need to step up only with 1 vaccine. And also when we talk about lockdown, I mean, we are not really Malaysia. We look into Canada. My friend in Canada said they have been locked down for the last 6 months. Only recently, and plus curfew, only recently they opened up. Likewise, in the UK, when they started, they used the herd immunity approach. That means you get infection, you recover, you got an antibody. But that approach have caused a lot of fatality. Now, in December 2020, they started lockdown in UK until recently, only last week, I think last couple of days. They locked down for more than 6 months, and they step up their vaccination. This is why we are trying to improve both. We locked down in March, and then after that in May, we started open up already, RMCO, and we open up all sectors. But until the PRN Sabah came in, that's where the issue of a partial lockdown, whereby economy sector is running, but not other sectors. So that's only the total lockdown that we are looking into is basically in the 1st of June. So, but again, we need to really step up the vaccination. And the vaccination, as you mentioned, is the issue of the coverage now. We can give you the vaccine, you can get the vaccine, but the coverage is only 15% for the whole country. For countries that open up in terms of their sector, their coverage is 30%. As mentioned just now in Dubai, 40% population already been vaccinated, then they open up. Now, this private entity now, because government have bought the vaccine, 48 million doses, so the priority should be given to the government first before the private sector. So the private sector just ordered recently, but we are in the front line, we are not getting our vaccine yet. So like Pharma Niaga, they have actually a responsibility to provide the vaccine to the government first, 15 million doses. So once they have delivered 15 million doses, then only they can sell to other parties. Now, if they were to sell to other parties, private or state or even factories, then they are bypassing the government's order. So that's why I think initially they have to give preference to the government. Now they really fulfill the requirement. They are opening up to other sectors. And now recently, Sinopharm vaccine been registered and Pharma Niaga submitted for Moderna. So now we hope that the private sector will open up the vaccination center, their own vaccination center, not the government vaccination center. Because in the government vaccination center, we have 15 million people waiting. So unless we can clear the 15 million people, then only you can have walk-in coming in. So this is a challenge for us. So we hope that the private sector now, you can access to the vaccine and then you can continue to vaccinate. And once the coverage now, the coverage is 15%. If we are discussing under the plan pemulihan negara, if we can increase 20%, so we can start to open up some sectors in terms of slowly, rather than wait for 40% of the population being vaccinated. So we are looking at 20% now. So now our target is we are in 15. So another 5%, we reach 20%. Then a few sectors, just like I mentioned earlier, will be open. So hopefully by doing so, we can help the industry. Now the assistance package, certainly not under my forte because under the Ministry of Finance. So we are looking at the health sector. And very likely, when you talk about inconsistency, Ministry of Health role is only to advise the MKN. Whether MKN implement or not, I mean, they have their own reason because we are giving the health sector perspective. They have to look into the security perspective, all economy perspective, and etc. Rightly or wrongly, how to strike the right balance between them. I think it's also good if they can engage and explain all the issues and challenges like what we are doing. Because we in Ministry of Health, we follow science, we follow data, we follow facts. Politics aside. So basically, this is how we try our best to contain the infection based on science. So hopefully, I know there's some discrepancy in terms of the implementation. For example, you talk about kedai pajak and kedai emas. Kedai emas probably is luxury for you to buy. Kedai pajak because you have to get the money. So that's why I think I'm not sure whether that's the reason. Maybe they have their own reason and explanation. Now the thing is that whatever they do, the explanation is lacking. So if they can explain the issues and challenges, then people will understand. More important, as you mentioned, engage, explain, and manage the expectation. Now, at least now from the health perspective today, you have the expectation of what we're going to do, how we're going to do, and how we're going to end. But the other sectors, whether for MOF or even the MKN, they also need to explain why the SOP, there's a discrepancy, there's an inconsistency, because sometimes when you do not engage, we do not know the reason. Maybe once you know the reason, yeah, maybe that's the reason why. So I think that is how I'm doing engagement every weekend, sometimes two engagement, and then to all sectors. This weekend, we're going to engage with the European Chamber of Commerce and etc. to make them understand the health perspective and how we're going to end this. We have done it before successfully without the vaccine. During the first wave, public have really spread all over the country, but we can contain the infection within 3 months using short, hard, and lockdown and recover very fast. But what we have learned is that we cannot prolong the partial lockdown to 10 months, for example. Everyone will suffer. But if it's a short, sharp, hard lockdown, I think everybody can tolerate 2 weeks, 3 weeks, then you recover fast. But again, this is lesson learned in terms of we do not have the experience of lockdown before. This is unprecedented. But learning from the past, what we have gone through, and now we can look back and see, I mean, every one of us becomes an expert on the hindsight. But the most important on the foresight, what to do and what not to do. So we learn something in terms of as we go along. And more important now, we have 3 months ahead, 3 months behind, learning from countries like UK. Can we now, once vaccinated, do not comply to the SOP anymore? No need mask, no need social distancing. We are going to learn. Now we are watching closely what's going to happen to UK, what's going to happen to Germany, and even in Israel. So then we will make sure that we use these two strategies, compliance to the SOP plus vaccination. These are the two solutions that we can have. Once we have that in place, border control is very important. So the moment we open up our border, new variant comes in, spread like wildfire, back to square one again. So I think that's why I think until today, we are very strict with our border control, and hopefully we can contain the infection as soon as possible. I think now that we look into our graph, there's a bit of flattening, which means that we are reaching the peak. Hopefully we are already in the peak and then going down. So hope that's our hope. I have said this before, we must prepare for the worst and hope for the best. And all these warning signs have been shared with you earlier in terms of, but again, now it's happening. We need to brace this together and hopefully we can overcome this storm. And thank you very much, sir.
Thank you, Tan Sri. I think that's your third wrap up. We really with you, Tan Sri, from the bottom of our hearts, we really thank you for spending for the last close to 3 hours with us. And thanks to your KKM team to have actually organized this, Tan Sri. We're really happy. Hope we will be able to get through this together with you. Thank you, Tan Sri.
Thank you all. Give a clap to Tan Sri. Clap.
Thank you, Tan Sri. Thank you.
Thank you. Thank you.
Thank you. Thank you. Thank you. Thank you very much.
Thank you. Thank you.
Thank you very much.
Tan Sri.
Thank you.
Thank you, everyone.
Thank you, Tan Sri.
Thank you, FMBA.
Thank you.
Thank you,
Tan Sri.
Thank you, guys.
Sorry.
Okay, Dr. Mira. Dr. Mira got very emotional just now. Too emotional.
Yeah.
Sampai aku nak menangis.
Nampak menangis. I saw you crying.
As well.
Speak from the heart, man. Speak from the heart.
Dato' Howard.
Yeah.
Thanks.
Sorry, Dato' Kumar?
A few, Raymond, thanks for coming. But I tried to call during the conversation, but I couldn't get like Prof. Susanna and all that. I tried to call her, and then like somebody was talking about education sector. I tried to call, but I couldn't really get that.
Yeah, Prof. Susanna texted me. He texted
Yeah.
me.
Dato' AT, I've been posting twice actually, but it's okay. I think some of the highlight is very clear there.
Thanks, Prof.
He has been answering a lot.
Prof. JLS, thank you.
Thank you, Dato.
Thank you. I brought up
Okay,
Prof.
Dato'
Susanna.
ATK, thank you very much. Very good suggestion.
Dato' Malik. Right. Thank you, Dato' ATK.
Dato' ATK. Okay, thank you. Bye.
Good job, guys.
Bye.
You've done it again. Dato' ATK, you've done it again.
Yeah, you've done it again. Good job.
Thank you. Great job. Thanks a lot,
Thanks
my
for the
friend.
FMBA logo behind there.
Yes, Dato'. That's what he did. He changed to the FMB logo.
Kalau tak dia kena ban tu lain kali. Dato' Malik. 18 will kena ban next time.
Yeah, correct. You'll change again.
Tipu cakap short one, 3 minutes, bro.
Thank you, Dr. Malik. Thank you so much. Dato' AT, thank you for giving us a chance to talk. Thank you so
got some
much.
good answers after a long time, Dorothea.
Yes, thank you. Yeah, I'm quite.
I think looking at what the DG said just now, AT, we have to brace ourselves another 3 months lah.
Yeah.
He didn't say it directly.
Yeah.
But he pushing here. I don't say that he pushing now, but the way he answer it is like he package it. The next 3 months only we can reopen. He compared us with UK. After the Euro Cup, they got about 50,000 infection every day, but it is controllable because they have vaccinated already.
Yeah.
So I think 3 more months lah. Where is Dato' Vira? Amir, I want to apply job in Maidin already.
Yeah lah. Can I get a job there? I have to say that maybe I have to offer my land for rent to Maidin lah to open one big one in Sabah lah, right? And Kalimantan is opening up as well, and they have changed, I think, their ibu kota to Kalimantan, so it's just quite opportunity there lah. I said Brunei is so coming up as well. So thank you everyone, thank you so much, and stay well and take care, and thank you so much for this engagement. Bye.
I missed a lot of things, Chris. Is it double dose they wanted?
No, actually, I think what Tan Sri sum up is this. First, number one, after double dose, we can reopen, but public health measure will still be there. That's what he said.
Single dose? No. Single dose not allowed.
Because he keep on comparing us with Israel. Israel, after the double dose, they open up, no mask, nothing, no SOP, everything goes back to normal, but now their infection is triple. All right, so that's what he said. So after double dose, public health measure is still there.
Yeah.
And because I knew what he's going to say, I asked this question: will we get tested before we go into a place or into an event hall or into somewhere or not? So he never answered directly because that is not under his purview, because that is under MKM, but he did novate the answer and says that at KKM, the frontliners is getting tested every week. So what they are actually using KKM frontliners as a pilot study. So if that pilot study is successful, they're going to tell MKM this is what they have done, and the public have to like test every 10 day one, for example, every 10 day once or 14 days one. And then when you test it, you will store the results somewhere, and then you show it, you enter the mall. Or he also suggested if you have enough demand, supply, not demand, on breathalyzer, before you enter somewhere, you do the breathalyzer test, 2 minutes, you get the result, and then you can enter. So that will be the future. So restaurants, event hall, offices will have breathalyzer. All right, then you go in. So he addressed that issue actually. So he also keep on mentioning 24th of June. He mentioned it many times, 24th of June. If I don't get the date wrongly, 24th
June, that's last month.
He says that the R0 actually came down, but then it came up again because of the Delta variant. So then he said Australia and also some other countries that actually, he mentioned Labuan first. Why Labuan was badly infected? Because the Indian people that came in from the India flight was not quarantined. So they take domestic flight. They were supposed to be quarantined if you follow SOP, but they did not quarantine. They took a domestic flight and they infected people inside the flight. Once they reached Labuan, then only they were quarantined. So it was too late. So
that's right. Yeah.
Common sense will tell you on the spot, the medical officer in Labuan should make a call and say that since we're going to quarantine this 6 Indian people, we have to quarantine the whole flight as well. Right? The medical officer can actually make a call.
Should have been done that way. Yeah.
The medical officer and the police can actually issue like 24 hours warrant, you know.
Right. That's
warrant
right. Yeah.
Tapi warrant, not warrant tangkap, but warrant to you know.
Yeah. They can do that under the act. Yeah.
Under the act.
Yeah.
So they can call back HQ to get an immediate decision. But this is our theory but things has been done. So Labuan out of 100,000 population got 7,000 people infected, the highest in Malaysia.
Right. Yeah.
So he also mentioned that why India cases went down, it is because a lot of infection, definitely the infection rate comes down. But he does not imply that we need to get infected, no, like what Boris Johnson said. So UK actually went to the herd mentalities. The more people get infected, the lower the cases will be. So right now, what Boris is doing is he is going back to what he said in the beginning. He took over from Theresa May. I vaccinate you 2 doses. You take care of yourself. You get infected, you cure yourself. I'm not going to be bothered really. So he wants UK to get herd immunity and get COVID infection, even though you get 2nd doses. But DG says that his role as a doctor is to save life. That's what he said. We still have to put public health measure even after we get 2nd doses. So it means that there will be continued SOP, there will be continued partial lockdown and so forth. But I think the key word, the key take back over here is that we're going to live with this lockdown for the next 2.5 months to 3 months. But hopefully if Tan Sri Muhyiddin Yassin, to our friend here, Dato Abdul Malik, can text him every night, besides sending him nasi biryani or whatever, nasi Arab, that after the 2nd doses of vaccine,
Dato Malik kena berani lah. Jangan hanya nasi berani.
Secret. Cannot tell the public.
That after the 2nd dose of vaccines, we are allowed to move around. Now, Dorothy, I also operate spa like you, we all know, right? So there is also an issue whereby a customer comes in fact, our therapist, because he got Delta, 15 seconds, our therapist doing the work and then got infected, then our therapist infect the 100 old people that come to the spa the next 2 weeks, you know. So that is also an issue. You open up, then suddenly you are closed up. And then not only you close up, you will incur financial losses because you need to quarantine the staff, you need to do tests, so there's a lot of things. So I think in our industry, we have to find another way. If we can work with someone who can give us a breathalyzer, our industry needs breathalyzer. Because we are in the feel and touch industry, we have to touch people, you know, in our services. So if we can order breathalyzer, I don't know who's going to supply it. Then after that, anybody that want to walk into the spa, they have to do the test first.
Because you see, I have about 13 therapists. They work in the hospital. So but my center, my spa outside, the outside are not allowed to operate. But then my 13 staff who are placed in 2 hospitals, yeah, I mean, they provide body massage, they provide, you know, I mean, those people who
physiotherapy lah.
No, it's not physiotherapy. It's just they are not physiotherapy. It's different from physiotherapy.
I understood, but what I'm trying to say is that why they allow this 13 staff to work, because they categorize it under physiotherapy. If you categorize it under body massage,